guidance and response to improved service delivery. We must try by all means to make sure that all ECD centers are operating within the law of their respective municipalities, but also those that are unable to do so for various reasons whatsoever should and must be assisted, because in doing so, we are safeguarding the future of our children. There are costs that some of these ECDs cannot afford, and we hope that this seminar will bring to the fore solutions to challenges of that nature. As at October 2020, we had around 1,338 unregistered ECDs and 623 conditionally registered ECDs in Gauteng. The number might be more or less in both categories, but ours is to make sure that this becomes a thing of the past. As a committee, we are of the view that this webinar will provide a platform for all stakeholders to discuss and find amicable solutions to the challenges that are facing the ECD sector. We did it with foster care, and I'm pleased to announce that there are positive developments through engagements like this one that we will be having today. And I'm sure if we would record the date, one day we will remember this day as a breakthrough, after the webinar of the 10th of September. So I hope that we will have success in our endeavor to make lives better. And I just urge everyone to, work together to build the future of the children of our province. I thank you. I think on that note, I think we are ready to proceed to the next item, which is the presentations by the various departments, starting with the presentation by the Department of Social Development, led by MEC Murakani, who will delegate an official to make the presentation. MEC Murakani, if you want to make some remarks, you can address the webinar. Over to you, MEC. Thank you very much.
No, thank you very much, Chair of the committee, and good morning to all participants and honorable members on call. Chair, I think in your remarks, you captured the very essence of the problem that we are faced with as a department and yourselves as a committee, and the ECDs across the board, registered, partially registered, and those that are not registered. I think the main crux of the matter is what you mentioned, the fact that if we don't address this matter and resolve it, we are sitting with a serious problem of a cohort of children who, when they get to different levels of education in their lives, they're going to find it very difficult to cope because because of the laws that we have at different levels of government. We are denying them an opportunity of development during their cognitive development state, the 0 to 7. It's very important, and I'm sure academics, if there are any on this call, will attest to that matter. So it is, one worries not only as a person responsible in government, but as a parent as well, and as a responsible citizen, that we can have a situation where our laws make it difficult for our country to prosper. So this webinar is very welcome, and I hope we will be getting solutions. Having said that, I'm sure you will recall that in one of the sittings of council, of parliament, of legislature last year, the Premier did allude to the fact that province is looking at resolving that problem because they're worried about it as well. So there's a bill that is just about to be adopted by legislature. It was tabled as a draft, whose aim actually is to address the very problem that we're sitting with. Legislature has a right, province has a right to legislate, but it must work with municipalities. So we have gone through that stage of consultation with municipalities, and I must say in this meeting, on this call, Chairperson, that the response we got from municipalities in Gauteng was positive, because they also realized that they have a lot on their tables, in their files rather, of what was then referred to as your old bylaws. They were referred to as, I'll remember the term now, but most of them they cannot use. They are not relevant. They are not even aligned to the Constitution. So the bill that we have tabled is going to assist municipalities as well. So I'm just hoping that the NCOP will also expedite it through their processes, and then we will be able to implement it to address this problem. It's a societal problem. We must address it and we must resolve it, just to make sure that we don't sit with a huge cohort, because if we allow it to go through without addressing it sooner, it means for every year we are churning out a number of children, or a cohort of children, who are going to struggle in school. So we are having discussions now as a department with academics for us to at least arrive at a percentage that is as close as possible to what we might be facing in the next 5, 10, or 15 years if we don't address this problem. So thanks, Chair. I think I'll leave it at that and allow the presentations to proceed. I'm not quite sure who the HOD sent for us. Just looking at people who are participating, because I left the meeting quickly explaining to them that I want to be part of this so that I can understand. So can they perhaps your staff members assist us, Chair, as to who is representing the department, who's going to present on behalf of the department?
Okay, yeah, I think Sipho can give us an indication. Sipho, do you know who's going to be making the presentation on behalf of the HOD? Or if she is here, she can just...
No, she's not.
Who is supposed to be here?
I don't know, I'm going through your list, because I was in her meeting, so I just left a meeting and came over here. Chair, I must apologize. I did not check who is. I must apologize to the meeting.
Kiba is supposed to be the one who's presenting. I've just checked with Yvonne. She's supposed to be in the meeting, but I don't see her also. Yvonne is checking, is trying to get hold of her so that she can join the meeting quickly. She's the one who's supposed to be presenting.
Who?
Kiba.
Kiba.
Oh, okay.
Yes.
Oh, okay. And then from the municipalities, Sipho, can you confirm if MMC Mgcina is here and MMC Vilakazi are here? Because if both are here, we can then in the meantime take either...
Through you, Chair.
Yes.
This is Lutando from MMC Vilakazi's office. MMC Vilakazi is currently tied up in another meeting. However, we do have department representatives that will be making a presentation. Thank you.
So, okay, thank you, Lutando. And then from the city of Joburg? City of Joburg, do we have any representative designated to do the presentation?
Morning, Chair. I'm going to check now. The last time I was speaking to them this morning, it was supposed to be the MMC herself, but I'm going to check again if she has joined the meeting. Maybe because of she saw that on the program she's not supposed to get now. Maybe she has not joined, but I'll make a follow-up on her office. Thanks.
Okay. Can I then seek permission from the meeting to just reorder the program in terms of taking the presentations? And since the city of Tshwane is here, perhaps request the city of Tshwane to start with the presentation.
I am here, Chair.
Oh, thank you, MMC Mgcina, and welcome.
Thank you.
Yeah, City of Tshwane, if you are ready, you can proceed with your presentation, and then we will keep on checking if the Department of Social Development is here. But I'm happy that Joburg is also here now. So if you can flight the presentation for us, City of Tshwane, Lutando, just flight.
Yes, hello, Chairperson, is Malapela from the City of Tshwane.
Okay.
The presentation would be done by Natalie Munisi. She will be representing the department, and then others will add upon what she has said.
Okay. Yeah, she can start. Over to you now.
Let me know if I should assist with beaming, colleagues.
Yeah, perhaps you should, Sipho, because I see the presentation is not up yet. If you can, please assist with beaming the presentation.
Ntse khona upha. Right. Right. Inele bona.
Me Felicita, you can mute your microphone. Thank you. Felicita, just mute. Thank you. Yes, Sipho, you can beam the presentation on behalf of City of Tshwane.
Yes, I'm trying to load it, Chair.
Thank you. Okay, thank you very much, Sipho. The presentation is showing on my side, and I hope it's showing on everybody's side. The City of Tshwane, whoever is designated, you can take us through the presentation. Thank you very much. Over to you. City of Tshwane, are you still here? I'm not sure what is happening on your side.
Excuse me, Chair. Let me just double check what's happening now, because we have our divisional head here as well. They're supposed to go through this presentation.
Please,
let me just
through the
let me just check.
presentation.
All right, just hold on, Chair.
I'm sorry I had to do this to you. I know that you were supposed to present last, but I think I might have disorganized you a little bit there. But I think if you are here in the platform, you should be ready at any time, especially that the presentation has now been flighted on your behalf. I was saying, Sipho, you can in the meantime check if the department is here, so that if they are here, we rather revert back to our program and start with them rather.
Yes, yes, Chair, I think Stibelo and Yvonne are here.
Okay, can we just then remove the presentation from the City of Tshwane, because I don't think they're ready, and let's revert to the Department of Social Development in that order. Yeah, you can flight the one from the Department of Social Development and they can take us through. My apologies, members, for this glitch. I don't know why our official seems so disorganized today, and it's something that is totally unacceptable, because all of them knew about this webinar. They should be ready, and once they've joined, they know they're going to present. They should be able to take us through without us waiting for so long. Yvonne, I see your hand is up.
Good morning, Chairperson. Good morning, honorable members. Apologies from DSD's side. We just had a little bit of a confusion because we are in a strategic planning session as well. Our Chief Director is in the meeting, Chairperson. And can I be permitted to project our presentation?
Please proceed, Yvonne. Thank you.
Thank you, Chairperson.
Good morning, honorable members and colleagues and guests. My name is Tibel Lomkonto from the Department of Social Development. I'm responsible for social welfare services. So I'm going to take you through the presentation on the impact of municipal bylaws on operations of NPOs and also on monitoring of NPOs. You can proceed to the next slide. The presentation is going to cover the purpose, the background, the legislative mandates, the registration processes, the registration of centers, the risk associated with unregistered or illegal NPOs, the monitoring of NPOs, and the conclusion. Honorable Chair, this is the brief that we got on the invitation that we should focus on. Thanks. Next slide. The purpose is to present on the impact of municipal bylaws providing services to DSD, to outline the legislative mandates that prescribe registration requirements, to outline the legislative mandate and scope of NPO financial monitoring, and to highlight the methodology, tools, and approach for financial and program monitoring. Next slide. In the background, the Department of Social Development delivers a variety of services, and some of these services are also legislated. We've got care and service to older persons. The services in this regard are, implemented in terms of the Older Persons Act. We've got the care and services to persons with disabilities. We've got services to persons infected by HIV/AIDS. We've got children in need of care and we've got early childhood development centers. We've got social crime prevention programs, victim empowerment programs, prevention and awareness of substance abuse. We've got services to families, poverty alleviation, and sustainable livelihood roots programs, youth and development programs. And these areas of service delivery are further guided by the Constitution and legislative mandates, and the implementation of such legislative mandates aims towards the reduction of social ills and improved quality of life for all. So the department partners with NPOs, that implement the services that I have outlined above. Next slide. Okay, in terms of the NPOs that partners with the department, it is very important that all the NPOs are registered in terms of the legislated mandates that regulates provision of programs and services. So it means that the NPOs, for example, that renders services in the field of children services, there is Children's Act that they still have to register with. So if you are registered as an NPO alone, you cannot render services, for children without being registered, without registering the program or your center, or the services in terms of the Children's Act. So we've got older persons that regulate services that have to be provided for older persons. For substance abuse, we've got Substance Abuse Act also that regulates how services have to be provided, for at the treatment centers, at the halfway houses, and at the community-based services. So the registration is regulated by the norms and standards. These norms and standards outlined in the regulations of the legislative mandates that I have mentioned. So there are programs that do not as yet have legislation, such as victim empowerment programs. Victim empowerment programs, the department is at the advanced stages of concluding the victim empowerment bill, and the persons with disabilities, we don't have legislation, but there are norms and standards that prescribes compliance, documents that are needed for the registration of the services that I've mentioned, where there are no legislative, frameworks. As I've already indicated, the NPO certificate, if the organization has got only an NPO certificate, that not authorize that NPO to provide legislated program or services. So it means that if NPO must still register with the legislative mandates that are there. And the department has noted an increase also in programs such as ECDs, the treatment centers, the residential facilities for older persons, the child and youth care centers that are operating illegally due to non-compliance to municipal bylaws. So the issuing of various certificates by municipalities, they are a prerequisite before the Department of Social Development can consider, a registration. So they need to comply with the municipal bylaws and ensure that they've got all the certificates that are required if they're going to feed people, the nutritional programs, for example, they need to have health certificates, they need to have, also, health permits and all that. So there are delays at times in issuing of the compliance certificates, and that then led to some of the organizations, operating illegally. In terms of the legislative mandates, Chair, we are, guided by the Constitution of the Republic of South Africa, which is Act 108 of 1990. That stipulates that everyone has the right to have access to healthcare services, sufficient food and water, social security, including if they are unable to support themselves and their dependents, appropriate social assistance. So the state must take reasonable, legislative and other measures within its available resources to achieve, the progressive realization of, the rights, that are prescribed in the Constitution. For Children's Act 38 of 2005, it gives effect to the constitutional rights of children and promotes the protection, development, and well-being of children. And of the Department of Social Development here is mainly registration of facility programs to ensure that they comply with what is prescribed in the Act. We have to maintain the database of everybody that is registered, whether we are funding that NPO, we need to maintain the database at event time so that we know who's registered, and all that. The responsibility of the department to provide capacity building programs to ensure that those who are providing services to children are providing them effectively and efficiently. Department is also responsible for monitoring and evaluation of the services. We register, and after we've registered, we provide capacity building to ensure that those who are providing the services are capacitated, and then after that we monitor the implementation of those who are providing these services. We monitor the program implementation, those which we are funding. We are monitoring even the utilization of of the funds that the department has given to those NPOs. We're also responsible for development of provincial strategies, because the Act will give a broader framework on the strategies that have to be developed. But here we are responsible to ensure that there are provincial strategies that guide services, or that guides how services have to be provided. And then also to develop and update the provincial profiles and resourcing in terms of funding of the NPOs that we partner with. In terms of Older Persons Act, we are responsible for to maintain, to increase and promote the status, well-being, safety and security of older persons, and protect the rights of older persons, as well as regulate and manage the prevention and combating of abuse of older persons. The Act provides for registration of residential facilities for older persons and community-based care and support services. These are the services that used to be called like body luncheon clubs, that are mainly in our, in communities, or the service centers that keeps our older persons, busy. Prevention and treatment of substance abuse is another legislation that makes provision for registration of treatment centers, halfway houses, and community-based services. Next slide. Next slide. Okay, in terms of the mandate, the department is working towards the mission of caring and self-reliant society by the advancement of sustainable goals, the National Development Plan, which is Vision 2030, and the vision of the GCR Accelerated Social Transformation Strategy. This social transformation strategy, the department is responsible for coordinate the implementation, and it's based on it's an integrated and well-coordinated social transformation service delivery machinery that is protective in nature, preventative, promotive, transformative, developmental, and generative for the delivery of equitable, sustainable, reliable, and efficient service to eliminate poverty, unemployment, inequality, sexism, racialism, and social exclusion, the burden of disease, increased safety, and provision of modern human settlement in partnership with active citizens. So this is the mission of the social transformation strategy. In going to the registration process, because that's in the main where I've mentioned earlier that we require the municipal compliance documents, such as the health permits and all that. So I just want to quickly, take us through the process, in terms of how do we do the registration of the program. First, the registration of the registration as a legal entity, or the NPO, or the business entity. So in this instance, the person who's applying, it must be either an NPO or a business entity, that applies, because we do register programs that are also not necessarily funded by the department, but they are operating as, as business, entities. So first, they should apply. They should get an application from the offices of the Department of Social Development, and in the application form, and also in the regulations as outlined in the Acts that I've mentioned previously, they should ensure that they get the municipal compliance documents. So if it's an ECD center, for example, they need to get both health permits. They need to zone, ensure that the place where they want to do the program is is zoned properly and all that. So they have to get those documents, and then because the department cannot move if the area is not zoned or that, it becomes a problem. Or even if the treatment center, for example, you find that people want to do it in a residential facility, so that will give, members have to, people who are staying in that community will have to say, yes, you can have your treatment center here. So compliance with program requirements, there are program requirements that are listed, that are prescribed in the register, in the regulations, such as documented treatment, documented programs, and there are issues of the menu that is going to be given to children in cases of, of ECDs and all that. The site assessment after the compliance documents have been packaged by the applicant, including the municipal compliance, documents. So the Department of Social Development will go to the site and assess whether what has been applied is also, as it appears in the application form. And then they will make recommendations for the HOD, whether to approve the registration or decline the registration. And if the HOD agrees with the recommendation that is made by the team, then she will issue a registration certificate. And then after issuing the registration certificate, then the process of monitoring and evaluation will continue up until the center is re-registered after 5 years. Some of the legislation prescribes that if you are fully registered, it's a period of 5 years. After 5 years, you must apply again. But in cases where the organization got a conditional, registration certificate, it's only for a period of 12, months in terms of the Children's Act, and also in terms of the Substance Abuse Act. In terms of the Older Persons Act, is 6 months only conditional registration. Next slide. Okay, these are the registration, the centers, and also what the requirements are from the municipalities. As you may note, in terms of the Children's Act, they are, zoning in the main, the rezoning of the consent use. They require the health certificates, they require the occupancy certificates, they require food acceptability certificates, and the emergency plan. So these are the documents that I mentioned, that before they can even submit the documents, to the department to say, here is my full completed application, they need to have receive these documents from the municipality. In terms of the Prevention of and Treatment for Substance Abuse Act 70 of 2008, we register inpatient treatment centers, halfway houses of the community-based services, but what they need in terms of inpatient treatment centers and halfway houses, because they are residential facilities, there will be approved building plans, the zoning, rezoning, consent use, fire clearance certificate, environmental health certificate, health clearance certificates, and also the fire, the EMS, certificates for Older Persons Act, which is mainly registration of residential facilities for older persons. We've got approved building plans, a health certificate, the occupancy certificate, and food acceptability certificates. Next slide. These are programs that do not have legislation, where I mentioned that we've got norms and standards that guides the registration of this program. We've got for victim empowerment, we've got victims for, shelters for victims of gender-based violence, and some of these shelters also admit, the victims of human trafficking. So as the department, we also look at the building plans, that from those organizations, we look at their health certificates, we look at their occupancy certificates and food acceptability, certificates before we can process their application forms. Same with the persons with disabilities. What is work in progress now is with regards to the shelters for homeless people. The shelter for homeless people, we're still in the process of, we finalize the strategy, which is busy. We are busy with the approval processes, and after the strategy has been approved, the plan is to also have norms and standards that will be guiding, the registration of, all the shelters that we are funding currently in the province. Next slide. These are just some of the challenges with regard to registration of centers. Number one, with the health certificate, the based ECDs, lack of uniformity in implementation of bylaws, in different municipalities. The delays in acquiring the health permits or the health certificates. And if there are these delays, obviously it says that they delay also the process of concluding the registration process of the particular program, whether it's an ECD or it's a treatment center and all that. The existing ECDs that are operating in RDPs and unproclaimed land, they are not issued with health permits. So this is also another challenge. In terms of the rezoning, the zoning or the consent use, the fees are costly, they are unaffordable for NPOs, mostly the ECDs. And also, although the zone is not a requirement in terms of the Children's Act, it indirectly affects the process of issuing of the health certificate, because you have to be zoned as such to say you are a facility or a site that provides these services. So if you don't have such, then it impacts on you issued with the health certificate. There is someone's mic which is on.
Yes, Zuki, so can you mute your mic, please? Please. Zu, please mute. Thank you. You can proceed.
Thanks, Chair. The Children's Act, the indirect, it affects the amounts also on the zoning and the rezoning. It differs from one municipality to the next municipality. Next slide. With regards to occupancy certificate, the residential facilities, obviously they need the occupancy certificate that indicates the number of people that have to be accommodated in that facility. So we work the bed capacity based on the certificate to say you can take 10 children, you can take 10 older persons and all that. Emergency plans, they're acquired for an EMS certificate at level 4, first aid, and level 4 firefighting, and training is required. So also this differs from municipality to municipality. With regards to fire clearance certificate is also, a requirement for registration of treatment centers, and it's also it's costly to get that certificate, and it differs also from municipality to municipality. Next slide. The approved copy of the building plans, the existing SECDs that are operating in RDPs. I've already mentioned that because of the fact that the lands are unproclaimed, so they do not have building plans and health permits. There are no titles, and they also the long and the delaying process is in getting the response, from the town planning, specifically at municipalities. Emergency plans, I've already mentioned that they are required at level 4 and level 4 and firefighting. These are just the risks that are associated because of the delays and all that. There are risks that are associated, because the more we delay to process the registration, and issue conditional registration where there is partial compliance to norms and standards, or give them full registration where the department is satisfied that they fully complied. The risk here is that non-compliance to municipal bylaws and program requirements, it puts the lives of service beneficiaries in danger, because those NPOs start operating without being, fully complying with all the requirements. So the lives of beneficiaries then are in danger. The facilities, often they appoint unqualified staff that are not adequately trained, and this all at times results in violation of human rights. The care and protection of children of the most vulnerable, of care and protection of the most vulnerable groups, such as children, adolescents, persons with disabilities, and women, is compromised. At treatment centers specifically, the treatment that they offer is not safe and it's not evidence-based. Others will use sugar to, they say it's detox. Others will eat people. They're saying that they're detoxing them. In terms of the medication that they are offering, that they're administering, also is not done in an expert manner because they are operating illegally and that don't have the necessary, professionals that are there, and anyone can do and issue the medication that they go and buy at the chemist over the counter. The increase in the number of community media and ministerial inquiries for the department, and lastly, the lot of litigation also into things that happen at these illegal facilities. In terms of the monitoring of NPOs, Chair. Next slide. The department have got both, it's monitoring, both financial monitoring. I'll also touch on the program monitoring of NPOs. So the mandate of financial monitoring of NPOs is Regulation 8.5, Treasury regulations that talk to transfers and subsidy. This excludes division of revenue grants and other allocations to municipalities as outlined in Section 38(1) of the Public Finance Management Act. This Regulation 8.4.1 says that the accounting officer must maintain appropriate measures to ensure that transfers and subsidies to entities are applied for their intended purpose. Such measures may include the regular reporting procedures, the internal and external audit requirements, and where appropriate, submission of audited statements. Regular monitoring or reviews of performance and any other control measures that is deemed necessary. 8.4.2 says that an accounting officer may withhold transfers and subsidies to an entity if he or she is satisfied that conditions attached to the transfer and subsidy have not been complied with, that financial assistance is no longer required, that the agreed objectives have not been attained, and the transfer of subsidy does not provide value for money in relation to its purpose and objectives. So 8.4 also deals with transfer and subsidy to other countries and international bodies and and other. This just tells the head of the department in terms of how to deal with transfers, and these are captured in our service level agreement that we sign with the NPOs. And the scope of NPO monitoring, that all NPO organizations that have valid service level agreements have to deliver goods and services on behalf of Gauteng social development, and SLAs were entered into in terms of Section 38(1) of the PFMA as transfers and subsidies. So the financial year, I think it's an error, it's supposed to be 21-22. So this is on the SOP that we use as the department. So that financial year is 21-22. Okay. These are the number of NPOs that the department signed service level agreements with for 2021-2022 financial year, and it's segregated per region. Ekurhuleni, we are funding 771 NPOs. This is an inclusive of all the programs that I've mentioned when I started, like older person residential facilities, older persons, your substance abuse and centers, your child protection organizations, persons with programs, persons with disabilities, HIV and AIDS, and all the sustainable livelihoods and all the programs that the department, partner with. In Johannesburg, we've got 1,021. So that's where the bulk, of NPOs are. At provincial level, we've got 43 NPOs that are funded at provincial level. They are providing provincial, they are providing programs in all the 5 regions. In Sidibeng, we're funding 446 NPOs. In Tshwane, we're funding 710 NPOs. And in the West Rand, we're funding 372 NPOs. So the total of number of service level agreements that we signed with the NPOs this financial year is 3,403 NPOs. Next slide. This is the methodology and the approach that we deal on financial monitoring. I'll also touch on the approach for program monitoring of NPOs. So the department undertakes scheduled and unscheduled monitoring visits regularly, and the frequency will be informed by the risk profile of each funded organization. See here, there are blend visits, and there are those that are not, blend. We look at the NPO and say this one is a high. There were issues of non-compliance here and there, so the organization, the department will frequently, visit those NPOs. So the frequency of the visits will be at least once in 6 months, given the internal capacity of the department. The department has been having serious capacity, issues relating to monitoring, and that is being addressed by appointing additional staff to, to strengthen the monitoring capacity. The department also conducts interviews with relevant of the funded NPOs to gather and verify data information, supporting documents as reported by the organization. The monitoring activities should broadly cover the overall financial aspects from budgeting, accounting to the value, the performance monitoring, and around the beneficiaries' risk and quality of service provided, and value-adding monitoring that should governance, human resources, and and etc. So we'll provide periodic feedback to the organizations monitored in pursuit of service delivery, improvement. So after the organization have been monitored, the department will go back and say, this is areas, this is your developmental areas, this is where you need to, to improve moving forward. I've touched the financial monitoring. I now come to the program monitoring. The financial monitoring is done mainly by financial people. So the program monitoring is done by social workers. So each organization is dedicated a social worker who monitors it to look at issues of compliance to the norms and standards that I've already, alluded to. So the objectives of the program monitoring program, if it's a child protection organization, for example, there are standards that they have to comply with. If it's a child and youth care center, there are standards, norms and standards that they have to comply with. So the responsibility of the program monitoring is to ensure that there is compliance to legislation, policy frameworks, and norms and standards. Is to ensure that services are provided in an effective and efficient manner, and that service recipients are satisfied with the quality service that they receive, because the quality of the service, the norms and standards prescribe what needs to be done for each, for each service. So when the social workers go and check the quality, they look at issues of other service beneficiaries for this service. Do they benefit? Is the service adding value to the improvement of their lives? Also enable organizations to meet policy and minimum standard requirements, and identify service delivery challenges. Where there are service delivery challenges, the social worker who's responsible will then, ensure that the organization of those challenges, and also identify capacity building and resources needed to develop, the organization, and provide mentoring to achieve, the developmental goals of the, of the organization. So the process of program monitoring is developmental in nature, Chair. So after challenges have been achieved, the department don't sit back, it works with the organization to ensure that those developmental areas that have been identified, they work on issues of capacity building that have been identified. The department also still take responsibility for ensuring that capacity building is provided to those organizations. There are specific monitoring that are aligned to norms and standards that we use for monitoring of registered, funded, and registered unfunded residential facilities and services. So because we've got norms and standards, most of these specific monitoring tools that they are used for monitoring of the program at the NPOs and the business entities that are, registered to provide the service. So they are aligned, to the norms and standards. So they will social at those, whether it's a funded or a registered. So legislation provides that those facilities as well should be, monitored. Next slide. This is the methods methods of financial monitoring. These are the methods that the department uses for monitoring of the NPOs. The first method that we use is it's called a developmental quality assurance, which is a DQA. This method is a very comprehensive developmental monitoring tool that is conducted over a period of 3 to 4 days. And depending on the size of the organization, others you can do, though it's prescribed that it can be 3 to 5 days. You find that in some instances, you can take up to 5 or 6 days because of, depending on the nature of that organization. Because in terms of interviewing the service beneficiaries, when you do the DQA, you must also interview people who are receiving the service to check if they are satisfied with the service that is being, provided by the organization, and including the department. The DQA process, it also looks at compliance norms and standards, and that resources that are allocated are used efficiently and effectively, and that those that derive the maximum benefit from these resources. We've got the second approach, the method that we use, which is called case audit, which is also a monitoring tool that has legislation and the policies and the norms and standards, but this is not as detailed as a DQA. A case audit, you can do it over a day or so just to check compliance and related issues. On-site visits, you can do, social workers do on-site visits that are planned and also to check compliance to the norms and standards. There are also unannounced visits that we do that without informing the center, you can go at any given time, because the Act makes provision for that if you've got any suspicion that there are human rights violations maybe in one center, the department can and just check, informing the management of that center. At times we do the head counts, the counting of residents at the residential facilities, because they will report that you registered for 50 beneficiaries and you claim for 50 beneficiaries. So at any given time, the department can just go and do the head count just to verify indeed you've got people in your facility. Next slide. This is inclusion. It's the last slide, Chair. The Department of Social Development is committed to work with all stakeholders, including municipalities, to the pursuit of realizing its vision, mission, and to improve the quality of the lives of Gauteng citizens. I thank you, Chair. That's the end of the presentation.
Thank you very much, Tebello. I was planning to, according to the program, take all 3 presentations and then open up for discussions, inputs, and questions. But I'm not sure, because you have already declared a Department of Social Development about your strategic session. I don't know what your situation is currently. If you want to rather respond to questions so that we tackle your presentation before you leave, or are you able to sit through the other presentations from the 2 municipalities and then we can take discussions and comments and clarity-seeking questions afterwards? So if I can get an indication from yourself so that we don't unnecessarily inconvenience you. If you can just indicate to me so that then we can proceed with the other presentations from the 2 municipalities. Yes, Yvonne or Tebello, I don't know who wants to speak.
Thank you, Chairperson. I think it will be highly appreciated, Chairperson, if we can be allowed to take questions. So CDM Konto can exit because she is presenting at the other platform as well. But social development, some of us will remain in the session for the remainder of the time.
Okay, no, thank you very much. Yeah, honorable members, colleagues, and our guests, I will then now open for questions so that we can allow the Department of Social Development to respond to those questions. and also give you an opportunity to engage with them. I see a hand from Portia Serute, number 1, followed by Les Sanabria. Those are the first 2 hands. And then there are Robert Seketi. There's 3 hands that I can see on the platform. And
Member
then, Honorable Member Magagula. Okay, you will be the 4th one. Okay, yeah, in that order. Let's start with Portia.
Thank you so much, Chair. My name is Portia Serote from Access Chapter 2. I would love to thank the wonderful presentations that asked a lot of questions that one was having. But however, I'm left with this one remaining question. These organizations are part of social development because they are reducing the burden by the Department of Social Development and Health, whereby the community members are found dealing with their own impediments. When the presentation was showing the process on organizations being legit, I'm asking myself when I'm sitting here to say, how are the community members in that regard be supported? Because the presentation was talking to the organizations that are already existing. So for those that maybe are trying to formulate their own organizations, how is then the DSD is assisting them? Because I'm looking at the process, it's a lot. You are monitoring also the structure and many other things. So how do we make sure that they are assisted so that they offload the work that the department is having? Thank you so much.
Thank you. The next one, Les.
Chair, I'd like to refer to 2 of your slides that Tabella gave. Slide 14, referring to the certificates, and I think she mentioned that sometimes this is brought out by the municipalities on an annual basis. I think we need, if we're going to have assistance to the NPOs, maybe we should look at this at as a 5-yearly process instead of annually. And one thing that is not mentioned, and what I would like to advocate with the slide 14, is that our problem is also with the utilities rates, with the electricity going up. NPOs in the disability and older persons sectors, as well as children's homes, need to have a special rate, and any other institutional residential place. Referring to slide 20, there is mention about the funded NPOs and that they are being monitored. As a member of the Human Rights Commission, I am got a problem with the unfunded, that they are not being monitored, and also we have a continued mushrooming of unregistered old age homes, which used to be guest houses right through our province, and nothing has been done. We don't see any figures mentioned by DSD in any of their reporting reports, whether it be quarterly or annual reports, about how many new unfunded institutions are being monitored and checked up. After all, the Older Persons Act and disability documents all state that these folks are the responsibility of the state, whether they are funded or not, whether there's an SLA or not. There has to be continued ongoing monitoring. Thank you, Madam Chair.
Thank you, Les, for the question. Can we have Robert?
Okay, thank you for the opportunity that I've been taken. I would like to ask about the conditional certificate that you have explained about, because in Fulham we don't have such a thing like that. So I would like to know from them, how do they operate with municipalities and monitor them to check they do comply with the provincial? because of why do I say this? Because we had some early child development centers who were receiving funding from the province, only to find that they were not complying in full. That funding was closed. So in terms of empowering those centers or supporting them,
Are you done, Robert? Are you fine?
how they decided to close instead of empowering them. Then, oh, yeah. The last question that I have is about the RDP. In Sebokeng here, we do have Bitumelo. They want them to operate like Van der Bijl Park. How do they balance the situation? Do they operate in rural areas and other areas? Thank you. Thank you.
Thank you. Les, can you mute your mic, please? Just mute your mic. And Portia, you can lower your hand. And Robert, please lower your hand. Let's take Honorable Magagula now. Honorable Magagula.
Thank you, Chairperson. I don't know whether some of the questions have been answered, which I'm going to ask because my gadget is giving me troubles on and off. Chairperson, I just want to, I did not hear what are the process to be followed for the NPO to qualify, the foreign organization to qualify in the department, Chair. I did not hear that.
Okay, Member Magagula, I hope that they will raise it. Let me just check if there's not any other person who wants to raise something. I can't see any other hand here. You know, from my side, my question is, you said that Tebello, that the issuance of a compliance certificate is a prerequisite, you know, by the municipality. And I noted that you said in most cases there are delays in the municipalities issuing those compliance certificates. But yes, it is a prerequisite. So I don't understand why then, if it is a prerequisite, why then do you proceed to fund when the all the paperwork is not in place? Because then at the later stage you will come back to say this NPO is not compliant, you know, and then you withdraw the funds or you stop the funds, even though you in the first place did approve that NPOs for funding, even when they did not comply in the first place. So I don't understand why is it that if it is a prerequisite, why then doesn't it remain so? Let it be a prerequisite, and then you fund them when all the mechanisms have been fulfilled. But then on the other hand, I've got a contradicting question, because you know that the reality of the situation in South Africa is that, fine, we have RDP houses. You've mentioned RDP houses. We have people who lives or stays on unproclaimed land. We've got semi and rural areas. We've got farms, and we've got people residing in those areas. So how then do we adapt to accommodate such people living in those areas? Because obviously they would not comply according to your standards, you know, in the townships or in any in the suburbs, for instance. And I think Robert raised the point to say, why do we have to use the same standards for Van der Bijl Park and Orange Farm, for instance? because the reality of the situation is that there are people staying in Orange Farm. There will be a need for an ECD center in Orange Farm. Oh my God. Sorry, I got lost there. I just got cut off a bit there. So my question is adaptation. And I'll give you an example. I once visited a... Hello, can you hear me now?
Yes, Chair, we can hear.
Yes, we can hear you, Chair.
Okay, thank you very much. I got cut off a bit there. I once visited an ECD center in Boskop. Boskop is, those of you who knows, Tshwane is in the far east of Pretoria towards Bronkhorstspruit. This ECD center is run by an heartedness, I suppose. They identified this community which stays in an informal settlement in Boskop. And they decided to erect a ECD center or facility for the community of Boskop, Boskop, because they realized that the children there are roaming the streets. They do not attend any ECD. There's just nothing happening in that area. The people there are not working. They cannot afford to take their children to any ECD center. So what they did, they set up a very nice structure there. They set up a very nice structure there in the form of these containers. Nicely painted with different colors, beautiful. It's fenced, it's clean, well organized, run professionally there. They've got a play area, a kitchen, serving nice food there. But the problem is they are on an unproclaimed land because they are in an informal settlement. And they are providing the service for free, by the way, because most of the parents, they cannot afford to pay for the services. Those that can afford, they pay 100 rands. Apparently, they're charging 100 rands minimum. Those that can afford, they can pay the 100 rands. But the majority of the parents cannot afford to pay. But yet they are running a service, a much needed service, and they're making an impact in that society. So I'm just supporting what I raised and what the other members' concerns are from the questions that are raised in terms of adapting your bylaws and, you know, all the policies surrounding unproclaimed people staying on unproclaimed land in the RDP areas, in the rural, in the farms, and anywhere else where the situation might not allow for them to comply in the standard fashion that you require or the standard that you have set of compliance. I think from me, that is my, you know, dilemma or question. I just want to really understand why is it impossible for us to really adapt and accommodate such facilities. Thank you very much. Margaret, your hand is up. Yes, you can come in, Margaret. Margaret?
It's not Margaret, it's somebody else.
Okay. Member Engelbrecht, you can lower your hand then, Margaret. Your hand is up. Member Engelbrecht, you can come in.
Chairperson, yes. My concern is that we haven't addressed the lack of the bylaws that we are addressing in accommodating the informal settlements. And the problem that we have, the bylaws do not accommodate the informal settlements and the lack of facilities that the informal settlements have. You cannot compare the facilities in a rural environment versus an informal settlement. So the bylaws are written for rural environments. Now you get to an informal settlement and the same bylaws apply for the informal settlements. And I have a huge challenge with that. And I really believe that we as a committee need to really sit down and look at the challenges that the informal settlements have, and we need to work with the municipalities. I mean, we cannot inform the municipalities what their bylaws should be, but I really think that we should inform the municipalities or have a workshop with the municipalities and say that we need to strategize and change the bylaws to accommodate the informal settlements, because the informal settlements really have a challenge to be able to conform with the bylaws the way that they are. So we're finding that your NPOs and especially the ECDs, my huge concern is the ECDs, are not conforming with the bylaws because they're not capable and they cannot conform with the bylaws. So we're finding that these places are not getting funding because they're not conforming to the bylaws, because they cannot conform with the bylaws. So we're finding that all these children that are sitting, that should be, what's happening is the ECDs are becoming places of care instead of being ECDs where they are really getting extra tuition, critical tuition in place of informal settlements, the places where our future children, our future generations are sitting, and they are not being trained the way they should be, because these places have become aftercare centers instead of being real grade A places of tuition because they're not conforming with the bylaws. So I think that we as a committee have a huge, huge role to play in sitting down with the different municipalities and saying, let's look at the real challenges at the informal settlements. They don't have water, they don't have the sanitary conditions, they don't have the facilities that the rural areas have. And I really believe that we are failing our communities, we are failing our people in the informal settlements. And whether it comes to NPOs and the ECDs, I feel we're sitting and we're becoming an academic institution instead of becoming a practical institution, and really sitting down and looking at what the challenges are and finding an amicable solution where we can practically sit down and find a solution to really assist our people. Thank you, Chair.
Member Engelbrecht, I think you've amplified the issues, the concern that have been raised by all the people who have raised their hands. Portia, your hand is up. I'm going to take you for the last time. I don't know if you want to make another question, ask another question or a further input, but you'll be the last one on this matter so that I can give the department the opportunity to respond.
Yes, I'm still on the question that we are talking about, because it's like the discussion already has started around those lines. The people at the ground level that are doing this work, they are doing a very good job. Like you said, they are improving the economy of the country. They are dealing with their own impediments. They create employment. At the end of the day, they are able to put bread and butter on their children's table. However, I don't want us to shy away from the fact that as much as they do that, it is as much as it is still risky, because they are not known. And as much as they are not known, it is as much as they might not do the expected on how they should be doing things. So the question still stands to say, how are we assisting them? Because really we need that. And you've raised issues like that are big, like the issue of land, of which what is the problem. You've raised issues, also the infrastructure, it's a problem. And these people really need to kickstart. So the question is, how do we help them? Because they are dealing with their own impediments and eradicating the social ills that we are seeing within the communities. Thank you.
Thank you, Portia. Yeah, you can drop your hands, Portia and Member Engelbrecht. I'll now invite the Department of Social Development to engage on this matter and respond to some of the questions that you members in this platform have raised. Department?
Thanks, Honorable Chair. In responding to the questions, thanks for the questions and also the, the comments that have been made regarding the, the presentation. The first question from Ms. Portia about how, are we going to support, or assist, the NPOs that are on the ground because they are assisting us as the department to implement, our mandate. As the department, what we do, we have teams that assist first from the NPO sector. There are sections that deal with from registration as NPO that assist, the NPOs that do not that are not registered. They are assisted with the, the registration processes and all that. And after they have been registered, we still have social workers that continuously guides and provide capacity building for those who are not registered, who wants to meet the required standards to be registered fully as, ECD. So we've got the capacity that assists them continuously to say, this is what you need to put in place, this is what is required, because these things are also regulated, they are in the legislation. So us as the department is to ensure that we have to comply to what is prescribed in our legislative mandate. So we've got teams that do that work and assist. So I think in the main, the department also at national level, there is approved conditional grant. The conditional grants that assist the ECD sector to also comply to, to the norms and standards so that they can be, registered even if it's conditional. So the conditional grant focuses on issues of infrastructure, also the risk personnel, that is provided to assist and, and capacitate, the ECD sector and do capturing of data to maintain the databases, and all that. So there were lots of programs that were also initiated at national level, such as Vanga Sali project, where the minister was saying that we should not leave anyone behind. All the ECDs must come forward so that they can be assisted, by the department and all that. We also have, with the COVID-19, there was the ECD stimulus package where the department was given money to assist both registered, funded and unregistered, ECDs, because there were people that were working there. So with the ECD stimulus package, it was not meant only for, for those registered who are already funded. So there is a lot of work that the department is doing to capacitate, the NPO, the NPO sector, in particular the ECD, the ACD sector. So you will know that as we are working towards shifting the function to the Department of Education, they will continue as such because they are going to be shifted. The function is going to be shifted with the funds and all the programs that have been implemented, they will be shifted, to the Department, of Education as such. So they will continue to work like the way in which we have been working, while they were in the department. The ECDs were managed by the Department of, of Social Development. Indeed, yes, they are assisting us a lot. The ECD sectors, community-based ECD sectors, they're assisting the department a lot because they are protection, they're providing care and protection to the children, and also developmentally, the other ECDs have got qualified professionals who, have gone through the courses, and they comply with the curriculum that is developed by the Department of Education in ensuring that children are educated and they develop, because if they are educated, but they are, the qualified professionals that are at the qualified practitioners are implementing the curriculum as is. We intend to see the outcomes later, in life. With regards to the questions that were raised by Mr. Les Sanabria, at looking at the 5-year process, unfortunately, with the bylaws, they are, it's the responsibility of the municipality, and trust they are in this meeting, they will guide, because some of the certificates, yes, they are valid for a period of 2 years, and after 2 years, they still have to go and apply, again at the municipality. So these are the issues that we need to continue, engaging, on. With regards to the issues of the challenges with utilities that are going up with our funding, what the department has been doing is to give the increments in terms of every year they are. You may know that the budget is shrinking and the department also gets budget cuts every year, but we have been funding the NPOs that are already on our database that we are funding. They get inflation-related, increments. So they can, as the utilities are going up and all that, I think it's something that we have to take back and look at if it's prescribed in your costing framework that you can only use 1% of your budget towards utilities. We will look at reviewing the costing frameworks that says maybe 1% only and look if that is still applicable. So it's something that the department can look into to say, is there a need for us to review the costing frameworks now, given the current challenges that the NPO sector is, is having. With regards to the registered, funded, registered and funded, it's our mandate as the department, yes, to ensure that everybody, whether you're a business entity or what, we have to monitor you, because we cannot give you a license and not monitor the work that you are doing. So we license, and it's our responsibility to monitor that you are still complying with our, norms and standards. If we find that you are not compliant, the HOD can revoke that license. You can take that license. So I know that we still thinly stressed in terms of capacity to reaching out to everybody, but it's our responsibility to monitor those funded and registered entities, more especially those that are run as business, entities. And with regards to unregistered centers that are mushrooming all over, yes, indeed, this is a serious challenge for everybody. And as the department, it's very difficult even to maintain a database, because you hear about people that, yes, indeed, in that corner there is a facility that is operating illegally. At times the department don't know about these facilities until something bad happens. It's then that we hear there is a facility there and a child died, or this happened to a child, or a person in a treatment center died, and all that. So it's only that we become aware of some of these illegal, facilities. But it's our responsibility as the department to continuously have media campaigns where we are educating communities about the processes of registration. Like I said in the presentation, that if you are registered as an NPO alone, you do not qualify to render the program that is legislated. You must also register in terms of that, of the legislation that prescribes or regulates how that program or the service, must operate. So we are aware of that. The department is going to embark on it continuously, more especially on ECDs and treatment centers. We've got documented proof that shows the media campaigns that we had with a province-wide to educate people. So it's work that is continuing, but we want also the stakeholders or the communities to join hands with us as and when you know of these facilities. Alert us so that we can go to them and make them aware that you need to be registered in terms of this legislation, because others are not even aware. When they say, I'm registered with the Department of Social Development, as an NPO, they are registered with the Department of Social Development, and they think after getting the NPO registration certificate, they can now run, run an ECD facility. With regards to the comments by Mr. Robert, I think I've missed, his line was not very, clear. I missed him a bit, but I gathered that he was talking about the conditional registration. Conditional registration is when you are partly, complying to some of the requirements. So we give you 12 months to say, please make sure that you comply. And it should be issues that are not going to put the lives of children or the lives of, you know, the service beneficiaries in danger. So when you give a compliance registration certificate, it's on the issues where you realize they can register and continue to function, and then after that you can evaluate and check if they are compliant after 12 months. So like I said, we've got the ECD conditional grant that was assisting the centers that are not registered and they are not compliant, to assist them to comply with the municipal bylaws. That grant is given to the ECDs to try and comply, and they will be conditionally registered. With regards to the unproclaimed land, I think maybe that question will be best answered by the municipalities, because as the department, unfortunately, we are not able to respond appropriately. NPO to qualify for funding, the NPO must be registered first as an NPO, must also be registered in terms of the program, and then also there are other compliance documents that they need to submit. Like, for example, if they're in NPO, they should be having a board of management. That board of management should be compliant with what is prescribed in the NPO Act in terms of the number of board members that are supposed to be there. They need to have the constitution that is ratified. They need to have audited financial statements. So there are a lot of issues that they have to comply with before they can come to the department and say, we want to apply for funding. But with regards to the registration processes, I've already mentioned that there are regulations that outlines what is needed for each NPO for them to comply. So they need to comply with the municipal bylaws that are outlined, like the health permits, the health certificate, the food acceptability certificate, the zoning or the rezoning, in some instances, the fire clearance certificates, and all those, the certificates that are needed from the municipality. So when they comply with those, then they still have to comply with program-related requirements. The program-related compliance requirements are, we want to see the documented program. If you say you are a child protection organization, or a child and youth care center, for example, do you have program in terms of what you're going to, what the program that you're going to be, providing for the children that are in that, child and youth care, facility? Did you vet all the members of staff that have to work with children, for example? They must be vetted, all of them, in terms of the provisions of the Children's Act. So they must not be in the register, for example. Do you have documented daily activities? Do you have documented, menus that are endorsed by, by dietitians? So those are the compliance things that we look at when we look at program, and a requirement. And after that, then the person can look at the application to say the structure, municipality is responsible for that based on the municipal, compliance document. So if we get those, we know indeed your structure is safe can accommodate people. We won't have any comebacks where people ban in the facility because there were no fire clearance certificate, or there's no, or they are not, authorized to provide food, in the facility and all that. So yeah, those are just the processes of qualifying, because the one step leads to the next. If your structure is non-compliant, it's very difficult for the Department of Social Development to can even authorize you to render the programs there if the municipality is saying, no, you are not complying with ABCD, so we are not going to give the compliance document. Chair, Honorable Chair, with regards to the issue of the compliance certificate and the delays and the conditional and the delays by the municipalities, yes, indeed, with most of the documents that are needed, you find that there are delays to receive those documents. That's why you find centers operating illegally without being, registered fully by or conditionally by the department in terms of the prescribed legislation. So I think for us as the department, what we continuously do is that all these challenges that we have listed here, these are standing at the ECD sector. The ECD has been the standing agenda item in our IGR, forum, where we're discussing matters relating to the registration, matters relating to the compliance and all that. So it's a continuous, it's work in progress, with the municipalities. In the last consultative session that we had, I know that SALGA promised that they will also start working on something, because issues of like non-standardization of municipal laws, because in some municipalities they will need this, and in other municipalities, they will need, something else. So it's work in progress, that we continuously do with the, with the municipalities. In the area services in those outlying areas, Chair, like those who are in the farms and where there are no maybe services, or they are poorly services. The department introduced mobile services previous years. The mobile services is non-center based ECDs. They are meant to ensure that we go to those areas to provide services to the, to children in those areas. Yes, indeed, it's not sufficient, and it's work. It's just that we are now handing over to the Department of Education that is going to, to be now leading the coordination of the, of the ECD sector. So from the department side, we already identified that as a gap, that there are children in the rural nodes that where there is nothing. So we had those mobile services to provide services, to go a bus, an ECD a truck or a bus that is tailor-made. It will go there and render, the service in those areas. So that's how the department has been trying to adapt to meet the needs of people who are in those, outlying, or under-resourced or under-serviced, areas. Chair, with regards to, yes, there are some ECDs that are in unproclaimed areas that are doing beautiful, program like the one that you mentioned in the Boschkop, areas. And indeed, those ECDs are caring and providing care and protection for our children, because they don't roam, the streets. And it's what the department has been doing is to continuously, we continuously work with the municipalities to ensure that what is it that can be done. I know they ask those documents, if they are not there, it's a problem, but we continuously work with the municipalities to ensure that they do, assist them whilst they continue to, to operate. But the challenge will be if anything happens to a child in that illegal or unregistered, ECD or any facility, then the first thing that it's asked is, are they registered, are they authorized, or are they licensed to even, operate the service? I know in the Citibank area at some stage we had an ECD that was in a grave site, and the department had to step in and, and close, that facility, because it was not okay for, for children. So we continuously work, with the municipalities there on issues of, of compliance. Maybe it's safe to say, Chair, that ECD is supposed to be a public good. Public good, now that is moving to the Department of Education. You may know that when the presentations were done on the ECD function, the Department of Education is looking at having, inclusivity in implementing the ECD program to ensure that no child is left behind, so all the children, as prescribed per ages, should be in the ECD facility. So if it's a public good, yes, indeed, it will be operating like, like your normal, schools and all that, and yeah. So it will assist us as we move, as the Department of Education move forward with, with regards to to this. So I remember Engelbrecht, it was mostly the comments with regards to the bylaws. And I think as a department, because the municipalities are also in this platform, I think we are saying that, yes, let's continue with the, with the engagements on the bylaws and see how best, the sectors are assisted, so that they can, comply, because it's indeed a catch-22 situation, Chair, that if the sender is not registered and something happens there, the first thing is, what happened? Why did you even allow this, to happen and all that? So it becomes, a challenge, Chair. Let me pause there, Chair, and thanks. I trust I have answered the questions, but I'm with my colleagues here. Anyone who maybe wants to add, they can add. Thanks, Chair.
Okay. Yeah, maybe before they add, there's one question. I think you've touched a bit on it, but maybe you might coin it differently. You can coin the response differently. Somebody asks in the portal about the, let me see. Yeah, Tandeka Zwani. She wants to know how will the move from DSD to the Department of Basic Education affect the creches. That's how she coins it. How will it affect? Sorry, I lost it a bit there. But I think it's there in the portal. I don't know what happened. I lost it there. I lost the pen, but you can just look in the portal. She just wants to know how the move will affect the creches and your budget, basically, from a social development. Yeah, that's the one.
Thanks, thanks, Chair. Unfortunately, I can't access the portal. I think I'm in the chat box, so I didn't see that. But thanks, Chair, for alerting. With regards to the move from GDSD to Department of Education, the move is not going to affect the functioning of the ECD sector. The ECD, that's why it's moving with the staff and everything. So the community-based ECDs, as they move with the staff, they move with the budget. This year, they're still going to sign the service level agreements with the Department of Education for 2022-2023 financial year. So there's no changes. There's going to be no changes in how the ECD sector is functioning. The registration process will still remain the same. The only difference will be that it's no longer going to be managed by the Department of Social Development, but it will be managed by the Department of Education. But nothing is changing. The same staff that was monitoring the ECD sector, that was doing everything, the finances and all that, some of those staff, they are moving, the departmental staff are moving to do the work that they have been doing with the, with the ECD sector. So the budget, the staff, everything that says ECD, it's moving, to the Department of Education. So there is a proclamation that has been signed by the Premier. There are memorandum of understanding between the Department of Education and the Department of Social Development that outlines how the Department of Social Development will continue to, support the Department of Education while implementing this new mandate of the Early Childhood Development Services. So there's no change there. Just from one department to the next department, nothing is changing. Thanks, Chair.
Okay, thank you, Bello, for the clarity. I want to move now. Les, do you have another pressing question before we move on to the... Okay, Les and Tandeka will take the last two hands.
Yes, Madam Chair. Reference is made to the ECD moving over to basic education, yet it still falls under the Child Care Act. Therefore, the leading department must still remain DSD. Not so.
So that has been sorted also in terms of moving the sections. That's why I said there is a proclamation, moving of the sections that prescribes how ECD should function. So that function is done also in a proclamation format. But when the Children's Act is amended, then that will no longer, it will no longer, be the responsibility of social development. So that has been taken care of through the proclamation by the president.
Okay, thank you. Thandeka, last bite.
Not happy.
Hi guys. I wanted to find out, okay, in terms of the moving, is it going to change in terms, like if the unregistered crashes, is it going to be affected or not in terms of that moving? And again, I heard that when the move is done, the first requirement will be the ECD teachers must have a degree of some sort or some diploma. So is it that true, or is still going to be level 4, level 5, level 6? I just wanted to find out that. Thank you.
Okay, Thandeka, you can respond there.
Okay, thanks, Ms. Thandeka. The move, it's not going to affect the registered crèches. Like I said, it's just only the fact that they will be now managed by the Department of Education. So we are moving the staff that will be, that staff that have been managing the ECD, that have been responsible for the ECD program. They are just moving to the Department of Education. They will no longer be under the employ of social development. But nothing is going to change in the next financial year. Like I said, we are going to be signing the SLA before the move is effected on the 1st of April 2022. The service level agreements would have been, signed. So we will continue. With regards to your second question was about the practitioners. The practitioners for now, it will be the Department of Education. After they have taken over, they will then say, this is how move forward with regards to the issue of the qualifications for those who are implementing the ECD programs. Remember, now there is a ECD policy of 2015 that outlines the roles and responsibilities of each department. So the role of the Department of Education is outlined in that policy. It's not going to be something new for them. That policy framework says that they are responsible for the development, the curriculum development, and all that. So they have been responsible all these years. So it's not something that is new for them. The legislation, the policy frameworks that are there, they are responsible to do A, B, C, D. So yeah, so there won't be any changes, with regards to the registration, with regards to how the ECD has been, the way we've been working with you as the Department of Social Development come 1st April 2022. But from there, we don't know how the Department of Education is going to realign the ECD, sector moving forward. But definitely there will be consultative sessions. You don't have to be and all the government is good at consulting. There will be those consultative sessions with the sector should there be any need for restructuring of how the ECD sector is currently,
Yeah, I think we've lost the Bello there. Her network seems to be landscaping challenges. Robert, I see your hand is up. Maybe you want to clarify your question because Tebelo did not get you quite well. I'm going to give you the last. You will be the last member to speak. You can speak now, Robert.
Okay, thank you. I'd like to ask again about the conditional health certificate. In Val here, 2014, they told us we are no longer going to have such a thing like that. So also they gave us the departmental form. This form, we fill it so that they could see that we are complying. There is town planning on it, and there is building survey, there is fire department. Then the last one is health environmental. So they told us this form is all in order from number 1 to number 3. So meaning on number 4, they have to issue a health certificate. But it's not like that. But you will find out some centers are operating while this form number 2, it's not filled in, but they do have a health certificate. You'll find others, this form is all in order, but they don't have health certificate. So also what I'm trying to say is that I want them to assist us in terms of this thing here, informal settlement. I don't hear her answering it clearly because she's trying to assist us and responding to all the questions. But the problem is that we are having a problem with our municipalities because the health inspectors, they don't treat us like the way she's explaining here. My problem is with the way municipalities working with us. Can she please elaborate that one of conditional health certificate? Thanks.
Okay, thanks. Oh, I think the further details with regards to, to the issues that you are mentioning, because the municipality, I gather that is the responsibility of the municipality and the process that they have, introduced to say to some extent that process is, compromising. Others they are given the certificate, whereas others are not, given. I think we'll need to get to get further details on that so that we can, assist, further. Thanks, Chair. I know my MEC is up.
Yeah, I saw it. Thank you very much for the responses, Tebelo. And yeah, I think we are going to get presentations from the municipalities next. And I think some of the questions will be responded to by the 2 metros that are here, Johannesburg and City of Tshwane. So in closing, I would give the MEC an opportunity to put her remarks forward so that we can move with the presentations. MEC Murakali.
Okay. Thank you very much, Chair. Yeah, actually, the reason I raised my hand was to respond to Robert's question, but Mem Kondo and yourself covered it very well. It should be directed at municipalities. But, I was listening very carefully to the questions that were asked by ECD practitioners. Those are the discussions that we normally have with municipalities. But I think it's also important that we amplify the role of SALGA. SALGA is helping us a lot in trying to get the municipalities to standardize some of the laws that they have, or what they normally call ordinances. Because if they don't, we sit with a problem as province, and we cannot assist NGOs broadly or ECDs. So as soon as we get to a point where SALGA is able to get municipalities to standardize, and the bill that I mentioned earlier on goes through legislature, and we're able to use it, most of the problems that are raised here will be addressed. Meanwhile, there is this thing about in municipalities where areas are not formalized, are not proclaimed, but they are formalized for purposes of billing. So our argument as province is that what is the difference? If municipalities can formalize to bill, why can't they then use the same policy to allow ECDs and NGOs to function? It's an arrangement. It's an internal arrangement by municipalities. So we are in discussions with municipalities around those issues. The problem becomes what Member Engelbrecht spoke to earlier on, when our officials now become very academic about issues that should be addressed for the purposes of us as government to give services to people. So, you know, until we get to a point where our officials understand that it's not a competition between them of who speaks better English than the other, or who interprets a law better than the other, and it's their own understanding, we will be sitting with this problem. So we appreciate the work and the questions that the portfolio committee normally poses in the meetings that we have with them, because they assist us as executives to really drive the message home that, you know, it's about giving services to people first. That should be at the top of our minds. How do we give services to people? We don't create unnecessary hurdles. So in that regard, what the Premier has done, he has put together a team that looks at red tape in government and how do we eliminate it to make sure that we don't sit with a situation where there's just talking and talking and talking and people are suffering. It also includes all of those questions that were asked by participants around informal areas and, you know, those kind of questions. So, Chair, I really am excited to be part of this webinar, because it is opening our eyes to many of the questions and the problems that we ourselves as the department have. And we recognize them as impediments to us giving services to our people. Thank you very much, Chair.
Thank you very much, Honorable MEC. Thank you for summing up the questions. I think it gives us a confidence to know that the department is indeed taking all these engagements seriously, and these engagements assist the department to you know, have a different view and reformulate and recalibrate all the policies and programs. Thank you very much for that. I want us to now move to the presentation from the city of Joburg, and we will take both presentations from Joburg and Tshwane, and then the discussions will come afterwards, after the two presentations. So at this stage, I will invite the regional director from the city of Johannesburg, who will be doing the presentation. Her name is Rosina, I think, yeah, Rosina Musiana. I don't know if I've captured the surname correctly, but she is accompanied by the MMC Mgcina. So over to you, City of Johannesburg. You can make your presentation, just flight it and go through it. And thereafter, City of Tshwane. I hope, City of Tshwane, you've got your house in order now. And then we will take the discussions afterwards. Over to you, City of Joburg. Whoever will be presenting, please come on the podium.
Hello, Chair.
What's the MC? Yes, Sipo.
I think she's still struggling to connect. I just got a message from her office just now. Maybe we can take Tshwane in the meantime.
Okay, Tshwane, are you ready? Can Sipo flight your presentation? Are you ready now?
Yes, Chairperson, we are ready. We apologize for what happened before. Then we are now ready to make a presentation.
Are you going to flight it yourself, or do you require assistance?
We require assistance.
Okay. Sipo, can I request you to flight the presentation on their behalf, please?
Can you see it shown aside?
Yes, I can see it.
Yes, we can see.
Yeah. Proceed, Tabang.
gone through the process now. There's no impact. Let's focus on to be delivered. So the structure as it
Chair.
Now.
Okay.
Yeah,
The presentation shall be done by.
There's no impact.
Can you hear me?
Yes, I can hear you. I'm just disturbed by the background. I don't know whose mic is open. I don't know if it's the presenter's one. If it is, please lower the other gadget in your surrounding, in your background. Otherwise, if there's anyone else who has unmuted, please mute yourself. Yes, you can proceed.
Okay, the presentation is going to be done by myself, Natalie Mnisi. I'm the Deputy Director responsible for early childhood development within the city of Tshwane. I'm also going to cover a bit on homelessness because it's one of the focal areas within the department. And having listened to the previous presentation, I will just have to oblige and go through the presentation the way it is. But that being the case, it is being presented by social development, meaning that we don't have all the answers that have been, indicated. The challenges that are experienced with regards to proclamation of land, the issuing out of certificates. But in the presentation, there will be aspects that will be covered to indicate how Tshwane has been trying over the years to sort of attend to those challenges that are prevalent. The operator that side, please assist me. I suggest that we move to the next slide, number 2. Please assist.
Sipo, can you
Am I getting assistance?
Sipo, please comply. Can you move the presentation?
The slides that start with the heading opening remarks.
Yes, Sipo, can you assist there? And also put it on slide mode. Ne? It's a bit small on the screen.
Okay, I will just.
It's moving on my side.
Yes, I will just read
you see it. And it's on slide mode.
Oh, okay. It's just on my side. It's frozen. Okay, proceed, MM.
Okay, then I will read then from what I have here on the table. Meanwhile, we are attending to the challenge. Balancing the scales of providing a safe and healthy
on your side, madam.
And operations and exercising municipal responsibilities is an ongoing consultative process. These processes require cooperation between departments, and social development has taken the lead to promote interdepartmental participation and collaboration. Part of the long-term goal of the Department of Social Development is to allow children to reach their full potential by investing in early childhood development, not only as a basic right, but a priority, and embarking on comprehensive reform of social programs that affect young children. The mandate, okay, you are there? The mandate for care and protection lies primarily with the Department of Social Development, but civil society, the private sector, and NPOs have a role to play in the well-being and development of children. Research, next slide. Research has shown the importance of early learning for later development. The effects are long-lasting, and the returns to education can only be achieved through an investment in early childhood development. Investing in the early years of a child's life unlocks their lifelong potential. Municipal bylaws are a vital policy implementing tool to ensure that NPOs render services within the required legal framework for the care and protection of beneficiaries of services and the successful implementation and compliance with bylaws creates a thriving environment for ECDs to access existing resources and creates potential for the expansion and creation of new resources. Conditional and full compliance is the prerequisite for NPOs to attain funding, and this has been the overarching challenge. This funding augments school fees payable by parents, and it promotes the overall development of the center. Moreover, exorbitant costs attached to compliance prerequisites and certificates disrupts program implementation. These costs certificates, health and partial care certificates, title deeds, building plans, unproclaimed lands, consent use, the list is endless. Some of these services are centralized and require traveling to the relevant office. Limited monitoring and evaluation of programs. Unfunded and non-compliant centers receive very limited interventions or support. Officials focus on funded centers to ensure funding compliance. Moreover, the limited number of officials cannot cover the breadth of centers. Next slide. Infrastructural challenges. ECD services are provided in center and non-center based facilities. This results in great disparities in compliance with infrastructural requirements. The spacing required for an ECD center per child is often difficult to attain, as some ECDs functions in areas with very limited capacity for development and expansion. Crowding often happens in centers where inspection isn't regularly conducted. Unspecified conditions for conditional registration. The conditions under which a center can be provisionally registered are not clear as per the Children's Act 38 of 2005. This causes great variations in conditional registrations granted, and no standardized agreement has been reached on the conditions under which a center can be provisionally registered. It has been noted that what is regarded as a conditional registration of one center could result in non-registration of another under the same conditions. Next slide. High staff turnover. Practitioners from unfunded or non-compliant centers leave due to non-payment of salaries. This lack of stability impacts on the functioning of the center. It affects child well-being and development, and it affects the implementation of the curriculum. Often the departing staff would have received free training across the levels of qualifications, and this leaves a qualification vacuum in the centers. Some practitioners venture to start their own non-center based ECDs, like the ones supported by Smart Start programs. These programs receive immense support from governments, and their compliance regulations are minimal. They sometimes charge less and poach children from other centers. Poor nutrition. Due to limited and inconsistent income from school fees, principals acquire substandard food, which does not always speak to the menu that is stipulated by dietitians. Unqualified staff. The landscape of the center is compromised of high numbers of unqualified staff and lack of assistant teachers as per requirements of the norms and standards. The direct implication is poor quality education. Research shows the importance of early learning for overall well-being of children through to adulthood. Children are stimulated and learn through play, and therefore basic skills and competencies are required. Basic training further allows practitioners to detect disabilities, discomfort, or changes within the child. The age of the fourth industrial revolution is upon us, and therefore professionalism of the sector is imminent. Low morale amongst principals. The conditions of compliance are financially taxing, and thus principals lose faith and morale. Even those that strive to comply end up feeling defeated. Partnership, collaboration, hesitancy. Corporates that previously assisted in developing the standards of non-compliance centers have become resistant, and this was fueled by the experience of the Esidimeni crisis, because people would always use that as an example. The developmental approach towards community programs is depreciating because of this hesitancy. The implementation of bylaws is the function of the Department of Health. Within Tshwane, our municipal health services are the ones that deals with issues of bylaws for childcare services. And social development within Tshwane provides a supportive role and a consultation platform. There have been several engagements initiated by the Department of Social Development within Tshwane over the years, including quarterly sector meetings, intra and interdepartmental consultations, and reports have been initiated. In Tshwane, we have what we call Circular 9 reports, whereby you would find that other departments also have to make inputs and comments. Because when you look at the issue of early childhood development, it's a multi-sectoral basket of services that needs all departments to be part of the process. There must be persistent engagements and cooperation between all spheres of government to ensure sustainable service delivery. It can't be a one-man show. The department further coordinates training opportunities to practitioners through institutions like Matthew Gonue School of Leadership and Governance. The City of Tshwane has been instrumental in ensuring that whenever there are training opportunities at whatever level and different cohorts, then database would be compiled across the 7 regions of Tshwane so that eligible practitioners would gain access to training opportunities that will enhance what they already have in place. And in terms of the municipal bylaws, we have indicated that this is a competency of municipal health services. Social development provides a supportive role. In terms of monitoring tools aid towards compliance. However, the non-funding of centers translates to non-provision of a monitoring role. The City of Tshwane has been funding community-based ECD centers since the year 2003. This was with the aim of providing the much needed financial support to enable them day-to-day operations. Up to this date, we have funded more than 800 centers with more than 50,000 benefiting. But unfortunately, due to issues of compliance, we have since stopped funding because we received a harsh warning from the Office of the Auditor General that we cannot continue to fund centers that are running illegally. We are not in a position to continue with the funding as long as issues of compliance are still hanging around. The report of the Auditor General was quite clear to say that we cannot be mandated on facilities that are considered to be running illegally. My presentation on ECD has ended there. Then I will proceed to give a brief background issues of homelessness, because as a department, we also attend to issues of street homelessness, which is a complex phenomenon in big cities with the inclusion of the city of Tshwane. Homeless people are spotted in various sites such as river streams, traffic intersections, dilapidated buildings, pavements, and in front of office buildings within the city center. There are over 10,000 homeless people in the streets of Tshwane. The location of homeless people itself poses a serious risk to the homeless themselves and the people affected. Risk are health, security hazards caused by the homelessness on the street. In the next slide, we have tried to indicate the hazards that we have. Next slide, please. Yes, and security hazards. In terms of health hazards, we experience urination on the streets because of the shortage of ablution facilities, drug and substance abuse, decrease in value of property. Experience coldness in winter. And then in terms of security hazard, pickpocketing crimes for passerbys, breaking in of nearby properties, stealing of materials in property, and then some homeless people, they would be in conflict with the law, or they would be people who have escaped from jail. There is currently bylaws which manages the issue of homelessness in the city. You are far ahead of me, but I will read from the paper that I have. However, the some point are used but don't have direct impact on the work of the homeless. The city, rather, has taken a humane approach to dealing with homelessness by introducing rather more friendly street homelessness policy. The policy talks about services for the homeless and less on enforcement. Okay, we can then go to looking at the increase in the state of lawlessness in the city. There is a need for bylaws which will manage issues of homelessness. The bylaws should seek to prevent people from begging on the street, more especially with children sleeping on the street, sleeping on the pavement, and sleeping just before buildings, because this creates safety and health hazards. The system was implemented during stage 5 of the lockdown, which make it a crime for the homeless to be outside of the buildings that they're not supposed to be at. And I'll just cite an example here with regards to the city of Cape Town, which has recently published a bylaw, which is in public for comment. This will make it an offense for homeless people to be sleeping on the street. Maybe we can follow, you know, from the experience of Cape Town. The city should have shelters for us in regions of the city. We have 7 regions within the city, which run west and reaches to the borders in the east in Bronkhorstspruit. And stakeholders should be brought on board, because again here it's not a one-man show. We need all hands on deck. Enforcement officers should be well trained to deal with the homeless and their rights to avoid abuse. Shelters should be equipped with relevant resources to make it humane and homely. Beneficiaries should be in a position to go and look for employment and income. Bad buildings need to be eradicated or demolished. Human settlements and group property must help here. Enforcement officers must be serious on implementation of the bylaws that also look at the humane way of dealing with the situation. And then information on where homeless people can be assisted should also be easily available. We have a few recommendations here. Various factors, and these recommendations will cover homelessness and the various factors, including access to water, poor infrastructure, poor sanitation, create disparities between ECD provisions and compliance with municipal bylaws. A collaborative approach within the municipal terms of service delivery would promote compliance and result in a swift and integrated response to issues facing ECDs within the city and the province. Funding at municipal level could focus more on practitioner training. This should be complemented by contractual obligations on the practitioner to ensure skill and competency retention in the sector. The training should transcend compliance status of centers, because our experience nowadays is that when we are required to comply, to compile a database of eligible practitioners, emphasis would also go to say you only pick up practitioners from centers that are compliant with the city bylaws and the legislation. So it creates a challenge. ECD registrations could be designated to partner organizations, or designated employees could perform this function. This will prevent the backlog of registrations currently experienced by the province. Ongoing engagements between the municipality, the province, and civil society should be prioritized to promote partnerships and a collaborative approach in ECD service delivery. Sustainability should be emphasized, and measures need to be put in place to capacitate NPOs as social enterprises to develop sustainability plans and guidance on how they can create additional systems of enhancing the functionality of their centers where funding ceases availability, either permanently or temporarily because of issues of compliance. Monitoring systems should be transformed from manual to digital. This will enable the partners monitoring the same centers or within the same region to be
I think your network is failing you a little bit there.
And stakeholders on how to improve or reinforce the of ECDs. This approach would also prevent the duplication of services between municipal social workers and our provincial counterparts. My presentation shall end here, both on ECDs and home.
Okay, thank you very much for the extensive and comprehensive presentation, Municipality of Tshwane. We appreciate the presentation. I will now move to the next presentation by the City of Johannesburg. Rosina, you can take us through. Thank you very much. Tabang, if you can mute, thank you.
Thank you, Chairperson, and greetings to the Chairperson and the Portfolio Committee members, and also acknowledging the MEC for Social Development and the MMCs from the two municipalities, Tshwane and the City of Joburg. Apology for MMC from City of Joburg, who's experiencing connectivity challenges. I will be presenting on her behalf. Thank you very much. My name is Rosina Masua from Social Development Department. I'm responsible for social work services within the City of Johannesburg, including NGO capacitation and empowerment. I'm also responsible for substance abuse program within the City of Johannesburg. I am not going to talk to the legislative mandate because I believe the Chief Director from Social Development, Gauteng Province, has already alluded to the legislation that impacts on the various NGOs, including the ECDs. The presentation outline will actually cover what the city is doing in terms of the NPOs. It will cover the bylaws and their impact on the NPOs, the role of the city in assisting the NPO sector, the impact of the bylaws on the ECDs, and measures that we have put in place to ensure that the bylaws are implemented, and also to assist the NGOs in meeting the bylaws. Next slide, please. Okay, perhaps as a starting point, I need to indicate that the city has a database for NGOs that are operating within the city's boundaries. And the reason we have set up this database is to make sure that when we engage with various departments that are actually custodians of the bylaws within the city, and in this instance, there are 8 departments within the city that are responsible for bylaw implementation, management, and monitoring. And it consists of the Revenue Department within the City of Johannesburg, Finance Department, Development Planning, Health Department, Public Safety, JMPD, which is the Joburg Metropolis Department, and the Johannesburg City Parks and Zoo, which is responsible for public open spaces. So as the city, we have set up a database of already registered NGOs with the Department of Social Development Province, where they need to register on the city. The required documents consist of the constitution of the organization, the NPO registration certificate, summary of activities that they are providing, the proof of the NPO address where it is operating, the municipal account statement, the tax exemption certificate where applicable, or proof of registry of pay as UN registration where is applicable, the 3-month bank statement of the non-profit organization, the latest AGM report and minutes of that meeting, recent audited financial statement, and any affiliation to professional body where applicable, especially where they provide professional services, be it social work services or environmental health services, and the acknowledgement letter from the ward council. The reason the acknowledgement letter from the councillor is required is for us to be able to know that the organization really exists in that particular area and is providing the services that is actually providing. The city's bylaws that impact on NPOs from the development, from Revenue Department is the property rates bylaws and the credit control and debt collection policy. The development planning is in terms of the municipal planning bylaws that refers to the building regulations in terms of the title deed, land use consent, in terms of approved building plans, certificates of compliance with electricity, as it was earlier alluded by Metebello. The public health bylaws consist of bylaws that actually covers issues of compliance with the food acceptability standards, and also the enforcement bylaws from JMPD is in terms of the NPOs that are actually operating in areas that either is in an invaded land or illegal land or illegal settlement, and also in terms of bylaws that impact on the work that is done outside areas that have been proclaimed. The public open spaces, it prohibits the use of open spaces without consent and prohibits certain conduct of, be it individuals or organizations in that particular space. Next slide, please. The role of the city in assisting the NPOs to meet the bylaws and to circumvent certain issues that impact on the NPOs from operating. In terms of the property rates, the NPOs, they need to register with the city
as indicated on our database, and we confirm that they are a public benefit organization. They will therefore be assisted in terms of the rates, where they'll be charged only 40% of their current monthly rates. And those NGOs with beneficiaries that are staying in the property registered on ESP for property-based benefits in terms of subsidized water, sanitation, electricity, and refuse removal. The subsidy, the cost is actually covered by Social Development Department. The debt rehabilitation special project has been put in place to assist the NGOs with insurmountable debt or areas that they can apply and make arrangements. And if they do apply and pay in line with the arrangement, they get a reduction of debt at 50%. This special debt rehabilitation special project has been extended until the end of December and has been communicated to the nonprofit sector as such. In terms of the credit control, the NPOs can make payment arrangements with their outstanding debt. Remember that at the end of the day, the city does not necessarily write off the debt that is there, but they can make arrangements to settle that debt. In terms of the training and development, we've got a capacitation and an empowerment framework that have been adopted by a council in the city, where we assist NGOs in terms, because there are 3 categories of NGOs in terms of the database itself. We've got level 1, level 2, and level 3. Level 1 NGOs are NGOs that are mushrooming, like Metebelo has indicated that they mushroom all the time. The ones that are just starting, that needs assistance in terms of capacitation, in terms of registration, in terms of funding, we do the capacity training workshops around that. And then we have adopted also a pay-per-service model, because funding of NGOs is actually a provincial mandate. So as the city, we make sure that every financial year we set aside 5 million to assist the NGOs, but we do this not in a form of grant or bulk funding of the organization. Instead, we do the pay-per-service model, where we do a call for proposals in terms of gaps that have been service gaps that have been identified in communities, and on response, the NGOs enter into a service level agreement with the city, and they are paid per beneficiary that has been serviced. In terms of the assistance with those that are operating from council-owned facilities, they are charged a nominal rate or a discounted rate. The normal fee is actually 499 rands per annum for an NGO that is operating from a council facility, and many of them have been actually accommodated within those facilities. Next slide, please. Okay, the impact of the bylaws on the ECD centers predominantly is the land use management, where I've actually made mention of the issues of building control, and also in terms of rezoning or consent use. What we have done as the city, we have set up a compliance team that is made up of development planning, which are actually the custodians of the municipal planning bylaws. It also consists of environmental health, which is responsible for the certificates in terms of food acceptability certificates, food acceptability and handling certificates. It also consists of a public safety rep, who is responsible for doing the inspections in terms of issues of the use of gas, fire safety, and signage for evacuation. And we are also incorporating the Department of Health, which is responsible for assisting and training these NGOs in order for them to comply. Additionally, we know that ECD centers, they face challenges that regard to disability requirements in townships and RDP houses, where they actually are unable to meet those requirements. And because the requirements are unclear for ECD operators, and the turnaround time is actually long in making sure that at the end of the day, they are able to accommodate those centers where there are disabled children in that particular space. However, as it has been indicated, that there is lack of alignment between municipal processes and requirements and those of Gauteng Department of Social Development. But through our IGR, we are able to discuss these things and see how best we can assist the NPOs moving forward. Next slide, please. The city, in partnership with the Hollard Foundation Trust, have developed a foundation to support
to provide support for ECDs, and the outcomes of this partnership will ensure that ECD practitioners get the necessary training needed to run centers and comply with the city's bylaws. There is constant monitoring of ECD centers and their compliance, as alluded before, that there is a compliance team that has been set up within the city of Joburg that is coordinated by the Department of Social Development, and also that there are further engagements and workshops that are held with ECD forums across the city's 7 regions. Additionally, we undertake the ECD police operations jointly with environmental health, emergency services, and public safety. Thank you. I think that is the end of the presentation from the city of Johannesburg.
Thank you. Thank you very much, Mayor Rosina, for your comprehensive and informative presentation. We really appreciate that so much from you and the Office of the MMC. At this stage now, I'm going to invite clarity-seeking questions or inputs to the 2 municipalities' presentations. If I can get an indication of anyone who wants to speak to the 2 presentations, please indicate by a show of hands. Portia and Les, you can come in. Portia can have the first bite, followed by Les.
Thank you so much, Chair. And thanks for both presentations. But you know, when I'm thinking like of solutions, but I'm not seeing how the Department of Social Department can resolve all the issues, because within all the challenges that has been made, it's also the Department of Human Settlement that has been raised in order to assist the process moving forward. So it is apparent that some of the challenges to be resolved, it might take long because they have their own challenges, as I attended one of their meetings the other day. The reason I'm saying this is that I'm also worried about the issues of people who are homeless. Yes, we do have most of the homes for them, but however, I'm worried about the LGBTIQA+ community because those shelters, they are not accommodating them. And we met in the other meeting with the HOD of Social Development. It was agreed that they would find 2 structures that are no longer used, and they will see how they renovate them in order to cater for those people. The other people that we are living outside are the migrants, because some of those people, they came here having documentations, but however, due to the system failing them, particularly Home Affairs, there are a lot of issues, and most of them are full in the streets of Tshwane. Everywhere you go, you know, it is making like Tshwane not a safe space, like the presentation has said. So it therefore means everything that we are doing, it actually needs a multi-sectoral approach whereby all the departments have to come into play. And I so wish somebody can follow up for us as organizations that are dealing with the LGBTIQA+ community, because we have been promised in one of the meetings by the HOD that they would look at issue of the LGBTIQA+ community, because they are not incorporated in terms of women shelters, men shelters, because of the sexuality, because other people are saying they don't want them to have sex, they don't understand them, they are confusing people, and all of those reasons. So thank you so much.
Sorry, Portia, if I can get, which HOD did you interact with?
Of director, the meeting was in, the hotel in, what is this, Kempton Park, just around Kempton Park.
Yeah,
it was on Shelter Indaba.
From which department? Was it from the Department of Social Development or from the municipality?
DSD.
Oh,
Provincial
okay.
DSD, yes, HOD.
Okay,
yes.
Thank
you so much.
Les, you can proceed.
Thank you, Madam Chair. The questions to the municipalities, and Johannesburg has mentioned the use of ESPs to try and help NGOs. I don't think that works because ESP is given to individuals and is based on 1 meter, light meter. In a children's home, you might have 100 children. You can't put 100 names against 1 light meter, so a children's home can't get an ESP. And on top of it, all ESPs actually related to older people. What happens in an old age home where you've got 40 to 60 older people, you've got 1 light meter. We cannot use an ESP as a basis to try and help our disabled, our older people and our children. We need a preferential utilities tariff. If the municipalities can give a tariff to Billiton at 14%, why not bring down the tariffs and not give a residential tariff to NPOs? Let us have a separate preferential tariff. We want to pay, but what you're asking for cannot work. DSD only gives 1% in the costing model, which is not a legislated process, which should be looked at and should be changed possibly to 10%. But I'll deal with that later in my own presentation. But municipalities, you are not being fair. I'll go one step further. Why should the NPOs pay for the certificates? I agree we need to have them, but you are getting tax, you're getting rates and taxes, and you've got property taxes from your residents. Let the NPOs are doing government work. We are making sure that the people that are covered by laws, Child Care Act, the Older Persons Act, and unfortunately, disability does not have an act. We are busy trying to work on a white paper, but municipalities, how about giving us free certificates for occupational health, the food certificates, all these things, fire hazards, they have to be there. But you are asking NPOs that are fundraising. We do not have a business. We are fundraising and our economy is down. We need your help. And we want to take hands. We are helping the people take hands with us and assist us. I appreciate the Portfolio Committee making this opportunity available, but municipalities across the board, I mean, let me give you an example. I've got 3 old age homes in Pretoria. I've got another one in Ekurhuleni. Let's take the Ekurhuleni one. 18,000 Rand a month is their water and lights, but they get a subsidy of 500,000 Rand a year. How can 1%, which is equal to 5,000, cover even 1 month of water and lights of 18,000? It's not reasonable. We are sinking, we are losing out, but you can help us. You look at your integrated strategic planning and see how you can reallocate funding there. So ESP does not work. It cannot work because it's not geared for this. And then when we come to your social housing, both Tshwane and Johannesburg, your social housing is not under the social development side. It is separate for indigent people, yet you've got people living 60 years old and over. It's not their home, it's your housing. And in terms of the Older Persons Act, that should be registered with DSD and should be complying with our minimum norms and standards. Where are you registered with DSD in terms of that? You're not. And that's why we had things like Casimir that was on TV, and it was an embarrassing situation for the poor MEC because Casimir is owned by the city of Johannesburg and is not registered with DSD as an older person's facility. We need to get our house in order, and that's why at human rights level, we asked SOLGA to help us. SOLGA says they do not have the legislative authority to intervene with municipalities. Must we now go to COCTA and call COCTA in to work with DSD and with municipalities and have them speak to us at the Human Rights Commission on older persons and disabilities? I'm on that committee, and we are frustrated by the fact that the municipalities do not comply with the laws that have been given and are being operated by DSD. There needs to be greater support and partnership between local government and DSD. Thank you, Madam Chair.
Thank you, Les. Yeah, I think in terms of the special rate that you are raising, I think it was a concern that was also raised by the NPO that I referred to earlier in Kungwini, the Frail Care Center that I referred to earlier, where they are privately funded. Of course, they are doing well. They are raising funds whichever way they are. They've managed to partner with various supermarkets in terms of food. Their main sponsor is Woolworths, of course. They run a good facility with an established kitchen. They cook there. They've got a laundry service. They've got huge washing machines, ironing. Staff is just taking care of all those people. But their biggest cry was because they've got such limited funding, they end up spending the bulk of their budget on municipal services in terms of water and lights. And they felt that they are rendering this a much needed service to the government. They are actually, in fact, assisting government to take care of the frail. But yet they are not being compensated for in terms of the use of electricity, and seeing that they do not have a constant flow of income, they are really suffering, and that compromises to a certain extent to on the quality of service that they at the end have to deliver, even though they try as much as they can to provide the best service, because people who take their dependents there, they do pay for the service anyway. But still, the money cannot be enough because they are running a huge center. They've got a huge staff complement, and they must maintain the building. It's a huge piece of land. They are on a plot. So I think that's a very important issue to raise, Les, for the municipalities to really consider and look at how they can incentivize these facilities which are assisting them to take care of the residents in their various jurisdictions. And then coming to the city of Tshwane, you talked about a policy in terms of the homeless, to say that you took an approach, a humane approach in dealing with this issue. And you said that you introduced a friendly street homeless policy. I just wanted to check with you at what stage is this policy? If you can just clarify if it's ready for implementation or if it's still in the planning phase. If you can just make us aware. And if it is ready, I just want to check if you are able to then share it with us, the portfolio committee. You can send it through to SIPO so that we can also look at it. We also have other ideas from other areas, because this is another matter that the portfolio committee has interest in, because since the pandemic, COVID-19 pandemic came, we saw how the department had no plan to deal with the homeless. But under the circumstances, they managed to, at least for that period, shelter them, and take care of the homeless and make sure that they take them off the streets. But after that, we thought we need to have a permanent or a sustainable solution as a province or as a country to ensure that we take care of the homeless and we reduce our streets from homeless people who are sleeping around everywhere. And you would remember that in Tshwane, there were incidences of homeless people being killed, and it was not very good. So we are very much interested in the study on homeless people. So that policy of yours would really assist if we can also have a look at it. And I know at some point, City of Tshwane was trying to come up with a policy. I don't know what happened in the process. It's quite a few years ago, around 2013 or so. There was a policy. It went for public participation. So I don't know if this policy that you are talking about is a new policy altogether, or was it a complementing on that old policy that the City of Tshwane actually proposed. So I will leave it at that. Les, if you could mute your mic, please.
Just a clarity question.
Okay, proceed.
Madam Chair, would the ECD matters that have been brought up now by the both metros, that will now all fall under Department of Basic Education, or am I getting that confused?
Okay, you can mute. Sipho, your hand is up.
Yes, Chair, I wanted to indicate that there are questions on the chat, just a few questions. Maybe I can read them out so that they can be responded to.
Okay, go through them. Thank you.
The one is from Margaret. How much funding at municipal level is available for ECDs in Johannesburg and Tshwane? And the second question is from Boipelo. Is it possible that a list of houses and stands belonging to the municipality be listed and made available to NGOs? Lease agreements and MOUs will be signed, etc., because we are struggling with space in Tshwane. And if you are apolitical, you don't get much help from councillors. And then there's another one from Portia. We are requested that too. And the HOD promised us that there are unused structures. I think she's responding to the question above. And then there's another one from no, this one I think it's just okay. Let me take the one from Ahang Boykomuso. Is 10-year-old organization. We are in Garangoa and run an after-school care program as well as sustainable livelihoods projects. We still don't have space to operate. That the name of the organization is Ahang Bokamuso. Then let me just check the other one. No, I think those are others are just comments, Chair. Those are, but we'll take note of those comments when we are preparing our report. Those are the questions, Chair, on the chat. Chair, thanks.
Thank you very much. Les, your hand is still up. Or is it an old hand or what? If you can just put it down. Let me see. I see another hand. Zanele, yes, you can come in.
Thank you, Chair. I just want to find out if there's any plan from municipalities to include drop-in centers into the bylaws, as we don't have bylaws talking to drop-in centers, and they also have to be registered like ECDs.
Okay, thank you very much, members, for the questions. I'm now going to give to the municipalities to respond. I don't know who wants to come in first, City of Joburg or Tshwane, whoever is can answer to that. Let's take Tshwane first, maybe. Yes. Oh, Rosina, your hand is up. You can come in.
Thank you, Chairperson.
I think. Hello, Chair. You
Okay.
said you wanted to start with the City of Tshwane.
No, Rosina came in before you responded. You can come in afterwards. You can pack your response for a while now. Let's take Rosina and then you will follow. Thank you very much.
Thank you very much.
Okay, Rosina.
Okay, thank you, Chairperson. I'll be responding to a few questions, but some I think they were actually comments and proposed solutions that the municipalities need to look at in terms of assisting the NPOs. However, I think in terms of the comment or the question on the ESP that children's homes and old age homes are not benefiting, including the social housing project that is treated as a separate entity. Maybe in terms of the responses that NGOs or NPOs are encouraged to apply for them to be considered for a reduction in terms of their monthly expenses. Hence, I spoke to the 40% rate that is being charged. But I also acknowledge the fact that I think it's Mr. Les indicated that NPOs are unable to afford that. As the city, we undertook a process of reviewing the ESP policy because we've also noticed that we've got a lot of gaps and a lot of flaws just to incorporate and to activate the social landlord program so that we are able to assist those that are taking care of children and senior citizens. On the issue of the listing of facilities and land to be made available for NPOs, we will communicate with our Joburg Property Company, who is actually the custodian of the city's facilities and land, to get a list so that it can be communicated to NPOs. We'll also share the list with the Provincial Department of Social Development so that they're able also to communicate to the NGOs that come to their space to apply for registration. In terms of the bylaws for drop-in centers, there are bylaws that are actually cross-cutting. So there is no specific one that says this is for drop-in center, this is for what, but bylaws that relate to issues of building control, issues of environmental health and whatever. So we don't have a standing bylaw that says only drop-in centers. And in terms of the issue of the preferential tariff that is being proposed, that there needs to be a preferential tariff for NPOs. This was one of the issues that we came across as we're doing consultation on the review of the policies. And I think as we also review the bylaws, because on an annual basis, a report is done to council where we propose certain amendments, and we will make sure that we also incorporate that particular thing. On the issue of certificates, that the fees that are being charged for certificates, whether it's the food handling certificate and is what, I think hence we set up a team as the city, a compliance team, and a report has already been done to council for approval where we've indicated inaffordability of these fees by various NPO, especially the ECD center. It is in the pipeline, and once it gets approved, it will be communicated to the NGOs. But as the city, we are pushing for that there be exemption for these particular organizations that are providing humanitarian and welfare services. Thank you, Chair.
Thank you, Rosina, for the responses. Thabang?
Thank you very much, Chairperson. I just want to start with some of the questions from posed by Portia, because she is the first person who raised issues. And she was concerned that we seem to be having problems and there are no solutions. I just want to put it on record that as the city of Tshwane, we have embarked upon the renovation of the centers. We had 10 million budget, which we used on the city-owned ECDs because they were equally not complying. And we have renovated them, and after renovating them, we wanted them to operate, but our sister department in the city, in the form of health department, said we wouldn't before they go do inspection in local and satisfy themselves. Instead, we then just established a committee, interdepartmental committee, with the departments which are stakeholders with regard to the issues of compliance, which are our own environmental health, group property, city planning, and metro police. That committee, we established it, I think it is last week. And as I am talking now, I just got a report that the city property officials are busy in the centers, making sure that they are assessing so that our own centers can be able to comply. Also, there was a question with regard to the issue of the LGBTBIT. Our own approach, because we are equally dealing with mainstreaming and institutionalizing programs for the vulnerable groups like youth, women, old elders, and people with disabilities. We are within gender, making sure that we also address issues of LGBTIT, because our own understanding is that we equally need to make people aware about the stereotype, the danger of stereotypes against this important component of society. So we are not necessarily perceiving them as people who must be addressed at the operational level alone. We are taking this program to the strategic level in the form of a special programs unit. We call it strategic interest groups. We are involving them there. And Chairperson, with regard to the issue of the homeless policy, the homeless policy was approved by Council in 2019. When we reported here, we said while we passed this policy and we were implementing it, we realized that there was a shortcoming in the form of enforcement. We became humane. We were more about service which needed to be rendered to the homeless people, but we did not necessarily embark much upon the reinforcement which need to be done, so that where there's like a sense which need the metropolis to come in, they will do that within the framework of the law. I think that is what we have been dealing with. The issue of the after school is Garangua. We would wish that we can communicate with them so that we can deal with their problem, because from where we are sitting, we did not know about this matter. But as they come, we are really much more to work with them. Like I can say that even with regard to the NPOs in the homeless, we've got the NPOs like Kopano Manyanu, Kitso Lesedi, Youth for Survival, Life Changing Ministries, and we are also working with institutions like the University of Pretoria and Tshwane Leadership Foundations on issues of the homeless. So it's a collective approach which is embedded in the community-based stakeholders which are confronted with these challenges every day on the ground. From some of the inputs which were made by Les, I think much of them were about the raising issues which we would say we must include them in the policy as we move forward, in the bylaws and policy as we move forward. But I also want to put it categorically clear that we will attempt again. We did had a report to council proposing a waiver on the fees when it comes to the issue of compliance by the NPOs which are working with us on issues of these important components like ECDs, the homeless and people with disabilities, etc. But unfortunately, it was turned down. But we will still, I think, again, we have a courage, given also what the Les has proposed, to go back again lobby with the politicians and to make sure that we at least update our policies so that we are responsive to the challenges which are on the ground and confronting our people every day. Thank you very much, Chair.
Thank you, Thabang, for the responses. Les, your hand is still up.
Thank you, Madam Chair. Just 2 comments. Thabang has raised something that's important about the street children. I dealt with street children from 1992 through to 2006, and I was also the Gauteng Alliance of Street Children coordinator. One of the things that we'll be faced with is the fact that the whole shelter system was changed, and all shelters had to become child and youth care centers, and that made it more formalized and brought it under the court system, which meant that we picked up problems with how do we handle children who come off the streets and then go back onto streets. I pioneered the New Nation School in Johannesburg, and it's the only state school for street children in South Africa. And so we're able to get them off the streets and put them into school. But then you had to have the cooperation of NPOs that were involved with street children. So that is one issue that needs to be taken into consideration. And then the one problem that we have is we've only had Tshwane and Johannesburg in our meeting today. We've got Ekurhuleni and Mogale City and the district municipalities. How can we make sure that they also are involved in policies and trying to get a tariff and free certificates for NPOs? It's just a question that I need to ask. How do we handle them?
Okay, thanks for the questions, Les. Tabang or Rosina, is anyone in a position to deal with that? The issue that Les has just raised. I know some the municipalities that you referred to were invited to this platform. Unfortunately, they were not able to respond accordingly, but we could not stop this seminar from taking place. Yeah, so even the MEC said there is that IGR platform. I think
I'm just so happy that you've got this, Madam Chair. It's so important, and maybe from the forum side, if we can have that promised relationship with the MEC and see how we can actually get the whole province going, we might be able to get some action. And also from the human rights side, I know from me personally, I do want to get some positive results and make it better for all of us in Gauteng.
Okay, thank you. Yeah, like the MEC also said, especially even around the homelessness, she also mentioned the integrated strategy on homelessness, which they are busy discussing at the IGR forum. Hopefully we will get a resolve on that. And also the other issues that have been deposited around the tariff fees for the NPOs and NGOs. I think that will also be deposited in that IGR forum. Tabang, you wanted to come in.
To say that, Chairperson, from the submission in the presentation, DD Municipality alluded to the fact that we are very much worried about the children who are roaming in the street. Some are being used to fundraise on the routes and so on. And we are in the process of making sure that in the bylaw, we put that so that we are able to deal with it. But again, another point in terms of addressing it, I think children, they are part of the vulnerable groups. As and when you are addressing them, you also need to look at them as within the lens of developmental perspective in terms of where we are going, particularly at the strategic level. We have got in our own office gender, we have got a desk which deals with children, and we also within the homeless unit, there are buildings which were given in the city of Tshwane. I think there are 6 in numbers, which we were about to renovate, but due to budget constraints, we had to put a pause for now. Those buildings would equally be utilized to house some of the children whom we think transitionally we can house them while we are trying to make sure that we integrate them back into the society. We are dealing with this at the policy strategic level, and then at the operational level, we can accommodate them if they are in the street and so on. But the bylaw would equally empower the Metro Police to deal with parents who are using children who are supposed to be at school, by the way. fundraise on the routes, on the robots, and so on and so on. I think that is how we can answer this question. Thank you. And then, Chairperson, you, in terms of the policy, I think you said we must send it to you. We'll definitely send it to SIPO so that you can see it and see how you advise on it. Thank you very much. I mean the policy for the homeless. Thank you, Chair.
Mr. Bang, just check on the chat room. There's a specific question that is raised by Buipilo about her issues there. Please try to communicate directly with Buipilo, get her numbers, and see if you can assist her, because there is a specific questions that she is that affects her that she has raised there on the chat room. So Tabang, please just check the chat room and exchange numbers with Buipilo so that she can communicate with you directly in trying to assist her. Thank you, and thank you very much for all the questions, the inputs, and the responses from the two municipalities. We really appreciate your cooperation in this regard. And as we move with the program, I am now going to invite the presentations from our various stakeholders who are going to make their submissions and inputs. I think after that, we will then just take a few clarity questions or just discuss if we have to. But these are inputs from the various stakeholders that are here today, represented by various people from the sectors. So I will firstly invite a submission by Pastor Sanabrina. Pastor Sanabrina from the Gauteng Welfare, Social Services and Development Forum to make her submission. Over to you, Pastor.
Thank you, Madam Chair. I've dealt with a lot of the issues here, and I think if I may just come and deal with one issue, because if I can just go back this, we've tried SOGA from a human rights perspective, and I've done that in my capacity as a commission representative. They can't help us. The tariff, we have got, we'll need to ask Eskom if they can also look at this issue, and it's not just these, because like Johannesburg City has their own tariff, and you've got Eskom as a separate entity that we'll have to ask about. But now, if we can get to the departmental DSD's costing framework, where they've got 1%, this is something that they themselves dealt with, and I was part of dealing with them and interacting with them. The 1% I said was not enough, and I said that way back in 2013. Maybe they can look at the other percentages and try and push up the subsidy, the costing framework for utilities up to 10%, and maybe remove from the other costing items, line items, and bring that down. And that could help the residential care facilities like old age homes, children's homes, and disability residential facilities. The local government thing with the no charge, I've taken note of that, and the fact that they are going to try and look at their rates, the preferential tariff. If I can, after listening to today's meeting, I personally don't think that the Department of Basic Education is going to be effective in dealing with ECDs, because if we look at the current situation with raping of children and schools, etc., we see that being taken by the SGBs and the department, and there are disciplinary action is taken. However, nothing comes out into a criminal case where these people are put onto the guilty parties in the list that we have at a DSD of child offences against children, and that is under the Children's Act. We can't, I know that they're talking about taking ECDs out of the Child Care Act, but the Child Care Act still covers people up to the age of 18. DSD still maintains and should still be the lead partner or province to cover that. And with regards to the older persons' places of accommodation, whilst they refer to Johannesburg, I heard this Johannesburg housing, it should actually fall under Section 79 Committee on Social Services when it comes to Johannesburg. I don't know what the actual committee is in Tshwane, but the Section 79 Committee on Social Services has no say over the housing committee in Johannesburg. They are working separately in silos, and yet we are faced with the Older Persons Act. And we are now coming to the fact that the Older Persons Act has been approved by Parliament. It's gone through the National Council of Provinces right now and will be on the President's desk for signing. And there, the definitions have been changed to include private homes where people who don't own those homes, which would come to the social housing aspect, need to be registered. Those homes need to be registered with DSD. There's a lot of work that's going to come to the provincial and regional offices of Gauteng. If I just look at our own province. So we are going to be faced with plenty of work, and I feel sorry for our social workers. But one last thing that might help us as NPOs, and this was something that Mr. Cavassier mentioned in on television. I take the liberty of using his name because he spoke on national television saying that there are numbers available where we can get hold of people. Those numbers have never been made available to the NPO sector so that we can actually cover issues on a regional level. We have actually asked for those numbers to be made available, and if maybe through the committee, through your committee, those numbers can be brought to us and we can publish it on our forum platforms, etc., so that NPOs know where to go and contact the right people in the right regions on the right fields of service. If I may close there, but I'm open to any questions. Thank you, Sipa, for putting my letter on, as you've got that there, 1, 2, 3. Those were the issues that I brought out, and then the things that I've commented now were issues that I've picked up whilst the presentations were made. Thank you, Madam Chair.
Thank you very much, Pastor Les. Your submissions are well received and appreciated. Let's move on to the presentation or the input by the Mfuleni ECD Forum. I will request Mr. Bobiki Seketi, if he is here, to take us through. If he's not, anyone from the forum who is delegated to make the submission, please do so.
Thank you very much.
Yeah.
Again. So I would like to start here. On 2017, we did make a petition to assist the things. Zone consent, certificate, the issues that we wanted to be assisted. We tried to engage with different stakeholders from health, environmental, social development, land use, building control, nutrition, different association of early child development. We didn't receive any assistance regarding this matter till now we joined this webinar. So what we are having in Influence is that firstly, we were funded with health reports for those who are trying to comply. Nutrition was funding all those ECDs who are trying to comply. After you fully comply, they will recommend you to social development so that you could obtain a funding from social development. It happens that they cancelled the health reports, saying that they are no longer going to use the health reports and conditional health certificate. It was cancelled. Therefore, my surprise it was that if a crèche have a health certificate, it will enable that crèche to receive two fundings from nutrition side, also from social development side. It will leave that ECD center that operate on the rural areas or on the informal sectors to struggle. That's why we'll end up seeing most of the children are not attending the ECD centers due to the way they're struggling towards to comply. So therefore, we try to engage with our health inspectors, their officials. They didn't give us a clear picture regarding towards this monitoring. What surprises us again is that you will find that there is more crèches who are operating without being fully compliant. Like an example, I will make a simple example. They will say to you, you must put a ceiling and a sink and what, then you will receive a health certificate. After doing so, they will come and look for another problem instead of trying to empower you or to assist you to reach the state of compliance. So you'll find another crèche without all those things that I have mentioned now, having a health certificate. So we ask ourselves, how do our municipality or the health inspectors operate their monitoring so that we could all comply? What do we want? We want what happens on the left side must also happen on the right-hand side. So this affects us a lot. Bye-bye. One of the good days, we were adjudicating for nutrition. There is this lady came from Midval. This lady from Midval, she was assisting her ECD centers fully so that they could comply. She was assisting them with the health reports. After issuing the health reports, she will follow them to fix where they must fix. After doing that, she will assist them to go straight to social development. But on our side, we ask ourselves why Influence is operating in this way, but Midval is operating in this way, but Listening is operating in this way, but we are on the same region. So that's whereby I decided, me and my colleagues, to write a petition about all these things. Like, for instance, we do have people from Bitumel. Already I have explained. Let me go to my petition. For consent use, let's say this lady is operating a crèche on an RDP or wherever she operates. They will need 15,000 for consent use. They will need 12,000 rand for rezoning, but there is no a source of helping that lady so that she could comply. So that is the problem that we are facing in Mfule. When we call meeting seeking the officials, we can't get hold of the officials. I remember wanting to present my petition to legislature. There was not even a single official from Mfule. They tried to contact them. They didn't get any hold of anyone. So that was so bad to me. So what I'm trying to say up again, we did have another lady from Nkelele. She was trying to go and comply to seek some other documents at Pretoria. When she get at Park Station, Johannesburg, she fell on the railway line and she died instantly, immediately. So those stories, they do not assist us to let's say to continue with our sharing. We decided, Like on my side, I decided to close my crèche because of I'm operating at a closed school, and where I'm operating my center, it's a community of poor of the poorest. So I try to bring the service to the community, but influence does not support that. With this regard, we request a conditional health certificate to be brought back to influence. We request health reports for those who are trying to comply to be brought back. We request for consent use and also for rezoning to be at least to be minimized so that we could do installments towards it. 500 rand a month, according to the way the ECD center can be able to pay. Imagine if I could pay, let's say, for instance, 24,000 rand. I don't have any funds now. Where will I get that money? Meaning they say, stop to do whatever that you are doing. Go and seek the job. And where else you love what you are doing, you try to assist the government so that you could bring the services to the community. It ends up being making things to be difficult for us, particularly on health inspectors. Social development, they will come to your center. When do they come to your center? They will see any problem, no problem. They will blame health environmental. When we go to the health and environmental, that's where the problem lies. Please, honorables, can you kindly assist Val? Can you please assist Influence regarding this matter? We want to comply. We want to be best centers. We created job for the poorest. So imagine when we close down, what's going to happen in our Val? Our Val is dying. An inspector will come to your center, passing a sewer on your gate. He will blame you, she will blame you for that sewer instead of assisting you to with material so that things could go in the right way. So when I'm about to close my presentation, we request bylaws to be changed so that they could suit our standard of living, especially in those who our locations, RDPs, Everton, we do request. And also, we request the municipality to reduce the compliance requirements due to lack of funds. Let them look at the center. Okay, we requested this center to do 1, 2, 3, 4, 5. At least she did 1, 2, 3. Let's meet halfway, or let's do 1, 2, 3, 4. So I'd like to be short because most of the things that I'm complaining about, most of them, they have been presented from Swani, from whoever who were presenting. So thanks for being given the opportunity so that I could be to participate. Thank you.
Thank you, Mr. Sekete. I would request that you submit your issues on paper. Just make a written submission with all the salient points that you have raised, as well as the recommendations from your side, ne? And then send it to SIPO, the contact details and everything. And that Robert, if I can request you to do that, we ngwale mo fatshe on paper, in black and white, and then we submit it to SIPO. Is it okay?
Yes, I will do that. Normal problem networking, I'll do that.
Yeah, no, because we didn't hear you properly. Your network was cutting off. Okay. Thank you very much. Poshi, I'm not going to recognize you now. I'll take hands afterwards. Let's move and take the next presentation first. And this is the presentation or the input or submission by the non-complying ECD forum. And I think Ms. Bikinyana Mbata is going to make the presentation. Mbata, if you can come through. Portia, you can mute.
Oh.
Member Tawaloka mo rutlwa dipampiri fela in the background. Are you ready to make a presentation? I'm not sure hore me o itukisetsa ho bua kampo o unmute fela mic wa hae ke mistake mo. I'm not sure who's going to make the presentation from the non-complying ECD forum. Can I get an indication who will be speaking? If maybe Kinyana is not here, there's another name, Lindy Wesibeko or Jeanette Sisinye, who will make a presentation. So can I check if any of those three people are here in the forum, in the platform, so that either of them can make a submission on behalf of the non-complying ECD forum. Let's check, Sipo. Are you aware of any of those members being here or not? If they're not here, then we will move. If they're not here, then we move on with the program.
I think let's move on, Chair. They are supposed to be here, especially Me Beginyana. But I'll make a follow-up. They can, in terms of the submission, so that it forms part of the report.
Yeah. Okay. Yeah. If you can just follow up with them.
I think there's Robert. Maybe he's going to give clarity because I think they're from the same region.
Okay. On that, Robert, come in.
So maybe we'll not pull a network. Let me check here.
Okay, thank you for the intervention. Yeah, we'll come back to them when we've got clarity. Let's go through to the input from Mfuleni Municipality, and I'll ask Ms. Koli Madiba to make inputs. Or if Ms. Koli is not here, anyone from Mfuleni, if there is.
I did not see, Chair, anyone on their side, but there's someone who asked if the meeting is on, and then I sent the link to not also to join. But I've been checking. I did not see them. Ms. Madiba, I did not see her since the beginning of the meeting. And there's quite a number of them that have accepted the meeting, but unless they've joined with a different connection or network, but I don't see any of them in the participants. Maybe we can pass that.
Okay. Yeah. So if we pass that, then while we're waiting for Robert's confirmation, I think I can take hands so that we can proceed with the discussions. And I had acknowledged the hand of Portia. Portia, you can come in.
Okay, thank you so much. All that I'm sensing from this meeting is that the ECDs, most of them, and in all the districts, are having the similar challenges like Bopilo was also raising and many other people. So I don't know if they should all via SIPO or what. And the other thing is that it has been mentioned that there is a structure that is in place that is assisting people in making sure that they are assisted and supported in making sure that they do things right and they are assisted in any way. So can we at least find the details of those people, where those people are, so that at least when we find, because we are organizations, we do have victim empowerment programs, we will have women who will complain of such things, but at the end of the day, we will never know on what is it that we should do. If SIPO is the relevant person, then guide us to say SIPO is the relevant person, or if there is somebody to contact, the relevant person who is relevant for us to contact on those issues. I think it's better that this meeting tell us on what is it that we should do, because it's more like everybody is faced with the same challenges in the meeting. Thank you so much.
Thank you. Yeah, I think I will task Sipho from the side of the portfolio committee to liaise with Yvonne in the office of so that Felicita, can you mute, please? Can you save us from your private conversations? Thank you. I will ask Sipho from the side of the portfolio committee to liaise with the office of the HOD so that he can get all the contact people that Austebello referred to who are there in the department dealing with various issues and various sectors, especially around the NPOs. And then Sipho will then share that information with all the stakeholders. If it's okay with you, Portia, I hope that will provide some guidance to yourselves. So Sipho, can I confirm with you that you will get the information through Yvonne and then you can share it with the stakeholders? Is it okay that way?
Yes, Chair.
Okay, thank you very much for confirming that. Yes, can I check if there are any more hands? Pastor Les, your hand is up.
Yes, thank you. What I wanted to say is that to just help with Portia, it was stated by DSD that every region has a person or people who can help those folks, and also from Robert's side and the other speaker, they can go to the regional office or even decentralized office where they are helped for free to get their NPO stuff in order and get registered. With regards to the other aspect of being registered with the, in terms of municipal bylaws, we'd have to speak to the social development aspect of the each Metro Council. But Madam Chair, DSD has got people, and they stated that they've got people who will help with the completion of the NPO registration. And as I said, Mr. Kabasia said he's got numbers, and if Sipho can get those numbers from Mr. Kabasia, we should be well away to helping after hours and under emergencies as far as any issues required.
Yes, thank you. Yeah, I think that's what we have said. We've agreed with Sipho that he will get those contact details for the relevant people who provide various services, and then those details can be shared with the stakeholders, as it were. May Felicita, your hand is up. You can come in.
Is Bikinyana Margaret Mbata speaking?
Okay, May, you can speak.
Health report, they must issue it back since we are busy renovating our center with what they need from us. So we are pleading the Emfuleni that they must bring back our health report so that we can do renovating, because we are doing a hand to mouth. We have only 30 children and you must pay staff again, and you will beat with what? So we are pleading, we need a health report for at least 4 years, because the money that issued from nutrition is going to us, is coming in on October. They pay us late. Thank you, madam.
Okay, ke a leboga Membatha ke o na tshwantse it's a presentation earlier from the non-complying ECD forum. Thank you very much. Ke tla kopa Ntate Sipho o tla liaisa le wena so that issue ya hao a ngwalwe fatshe so that e nne submission ko department a kere. O tla o founela bue le wena and then re hore issue ke eng ba khone ho isala morao. Thank you. You can mute your mic, Me. Felicita.
Honorable.
Yes.
Oh, Ritu, Honorable. So I would like to make some points for Mfuleni.
Okay, you can come in.
Okay, my name is Winnie Timbani. I'm also based in Mfuleni. So my concern is about the building plan. The building plan is a problem to us to have it because we're working from hand to mouth. So if the municipality can help us, maybe with the health report, so that we can be in nutrition, and then so that the money that we are getting for the school fees, we can be able to pay for the building plan, because the building plan is costing us so lot, whereby we can't even afford. And the other thing is a title deed. Not all of us that we have the title deeds. And then if you submit your documents, they want the title deed, they need the building plan. So those two parts are the main concern. We can't afford to get them. And title deed is not easy to have title deed because you have to go pillar to post, and especially when the property is not fully paid. You can't have a title deed. So we are not being able to get help from the municipality because of the title deed and the building plan. So the other thing, I'm asking not to be victimized. When they visit the centers, we've been harassed by the inspectors and the social workers. If they can build us, not harass us, that will be a pleasure working with them. Thank you.
Thank you, Mama, for your submission. Thank you very much. It has been noted, and I think we will also arrange that we get something on paper. And then I'm going to request that, and Tate Robert, you also spoke about a petition that you had submitted. Can I request that when you make that written inputs of yours, also include the petition that you spoke to, ne? Include that petition, and we can see where do we how do we deal with that petition. If it needs to be sent to a particular department, it will be sent there, and then we will be able to follow up if it has been resolved or if it's in the pipeline to be resolved. Robert, yes,
can I come in on that, on the matter of the petition?
Yes.
I managed to join remember the 12 chairs oversight visits. I think it was last week. So that petition was dealt with there in that meeting. It's then that I managed to get hold of Robert and other colleagues, but that petition didn't come to the committee before it was presented there. But I'm going to make a follow up. It's good that you are saying he needs to forward it to us so that we can check progress, because I don't think there's something much that has been done in as far as that petition is concerned. But he can come in and clarify. Thanks, Chair.
Thanks, Sipho. Robert, Dr. Robert.
Thank you, Newark. The petition, we have managed to deal with it, I'm sure, 2 weeks back. And also, I would like to clarify that for the title deeds from Women Settled Settlement, they are still assisting us now. Those who are having challenges for title deeds, we are now sorted for that, unless if it's a very difficult situation. So the other thing is that for that, I wanted to put clarity on it. They gave me 14 days to respond on my petition. So fortunately, Mr. Zimu from Enfuleni is still liaising with me about the petition. But we didn't close it because before we close, we need assistance from Enfuleni so that things could be okay. Then lastly, I would like to add something towards my presentation, Mewak. It's that departmental form. I so wish if there can be an audit through at Enfuleni, because we do have the departmental form. Some other centers, this departmental form, it is not even filled, but they do have certificate. That lady Lindu who just speak now, he was talking about the health inspectors. I'm one of the victims who was harassed by a health inspector. I can't say a name now. Even till today, my departmental form is all in order. All is left is for health department to say, okay, we are giving a MEC for 1, 2, 3, 4. So I can't be assisted. I decided to close the center to go and look for work so that I could be able to fix where I can fix. So can you please assist us? And the other thing is that the officials from Influence, when we need them regarding difficulties matters, especially those who are the decision makers, they can't attend. So this thing is serious. Please, can you please assist us? Because Ms. Nolo will talk here, but she will not be able to take a decision on behalf of the other one who are the decision makers. Thank you.
Thank you, Dr. Robert. Yeah, if you can also include that in your written submission, it's a pity that there was supposed to be an input from the Enfuleni municipality, and unfortunately, they did not come, even though they had promised to be here, because then they would be able to. May Grace, please, just respect our meeting and mute. We expect Ms. Xoli Madiba to be here with us so that she would be able to take some of the issues that you are raising, especially the sectors from Mfuleni. So unfortunately, I don't know, but I think your written submissions will assist in us, and we will see how we can direct those issues to Mfuleni, because some of the competences, as you know, it's a municipality. The province, the Department of Social Development have got limited access to some of the facilities and some of the functions which are designated for municipalities. So some of the issues have to be resolved by the municipalities themselves, and they have to make an undertaking to resolve those. But Rona, as portfolio committee, I don't know how we will be able to channel that to them, but I'm sure we will have a way of engaging whoever in Mfuleni, and hope that they will be responsive, because we do not have a direct control over them. We don't do oversight over them. They do have their own oversight committee in the municipality, the oversight committee of social development. So maybe we will also try to interact with the chairperson of the portfolio committee there, if there is one. I'm not sure which system they are using, but we will find a way. When I just submit those to SIPO and Dr. Robert. Thank you very much. I don't see any other hands. I think we have come to the end of the comments made by the. Okay.
I have a suggestion for you to help you as well. That maybe you can write to Commissioner Malachi and ask if we as Human Rights Commission can help and support you in dealing with the local government and getting action on, definitely with the older persons committee, we can do that, and disabilities.
Okay, thank you. Much appreciated, Les. I think we are partners in this regard. Yes. We should to work together. Thank you very much for extending the hand. Robert, your hand is up.
Mewaka, I wanted to ask Corina, those who come from health, from nutrition for funding, we requested them to be here. Are they here now? And happy, the last question that I'm having to our municipality is that we do have drop-in centers around here in Val. They do have health certificates, but if you can go to where do they work compared to our ECD centers, you'll find that we are better than them. There is no bylaws that are being implemented towards them. So we request to be treated in the same way so that we could have a mercy, so that at least even us, we could try to recollect ourselves. I did forget about that point. It's for nutrition from the health department, from John Hayes. We request them to be here and also this matter here, a shopping center. There are so many centers which are here. We can count all age homes and shopping center. They don't have health certificate and a permanent one. And I want to find they still have kitchens. They still go the same way that we are going. The goal is one. We are servicing the community. We are servicing the poor. So why us we will be left out? Thank you very much.
Yeah, I'm going to repeat, Ndade Robert, put everything on paper, no? Please, all the submissions that you've made, if you can reduce them to writing, I think it will assist. Thank you very much for the submission. Yeah, I don't see, there's no one from the health sector here, according to my program, Ndade Robert. So I think we have reached the conclusion. Katekani, community representative, you can come in before I close. Come in, May.
All right. Thank you very much, Chairperson. Greetings, colleagues. My name is Tawang Leshaban, as I already highlighted in the chat box. From Gauteng Community Project, we are based in Tshwane, Region 1. What I would like to say about the presentations that was presented today is that they are relevant to the services that we offer at Katekani, because what we do here, we've got a boy-child program. We're implementing a men and boys program, and then for this meeting today, I would talk only about a boy-child program. What we do with these boys is that we've got your HTS programs, you've got your gender-based violence program, more especially in bullying. We support them. We've got social workers and social auxiliary workers, and psychologists, volunteer psychologists who are assisting in implementing the program. So what we want to know is that in most cases, when we talk about assisting the CBOs, is when we talk in this meeting, I hear that most of the time when we talk about the ECDs and shelters that are accommodating boy-child. I want to know from both municipality and DSD if when they support that budget that they highlighted today, when they said they will be assisting the organizations, will they be assisting only the ECDs? And again, will they be assisting only the ECDs, or they will be assisting even as the CBOs, the community-based organizations? Will they be assisting? Second question, will they be assisting the funded organizations, or even us, the non-funded, non-municipal funded organizations? If not, what kind of capacity building can we maybe benefit from both municipality and the department? Because it is not only about, when we talk about support, it is not only about monetary support. We also need capacity building in attending various cases that affects the children, more especially in schools, and those that are out of school and have to be enrolled in schools. Thank you very much. That was my submission.
Okay, thank you, Thabang. Unfortunately, you came at the tail end after the department, I think, has left because they had another meeting to attend. I'm not sure if there's anyone from the Department of Social Development who is still here to respond to your question, because we have long dealt with that item earlier in the agenda. And from the two municipalities who made presentations, let me also check if you are still here to respond to the question that is raised by Thabang. If there is, please come in and respond. Veronica, do you want to respond? Or are you raising something?
Yes, please, Madam Chair. I want to respond to Tabang from Katakani, if I may.
Okay, thank you.
Thank you very much. Just to say, we are aware of the organization, and recently, from the provincial side, they visited the organization. Capacity building will take place. We offer capacity building to the staff, the volunteers, the professional staff of the organization. So that the training needs that the organization has verbalized to the team that went out, we have noted that. So if and when the trainings will take place, they will definitely be included in all the trainings that the department from the victim empowerment program that we will be offering. Thank you so much, Madam Chair.
Thank you so much, Vero. Thank you for the response. Thank you very much. Let me see. Yeah, I think we've exhausted all the questions and you have responded. I don't think there's anything matter outstanding at the moment. But maybe just to say that I think we've come to the end of our webinar, and I think we did have meaningful engagements. And I urge those that have not made written submissions to please do so as requested, so that we can also capture the essence of the grievances and the recommendations that you want to make for the departments and the municipalities to take forward in an effort to enrich our discussions and finding lasting solutions, because you, as the people who are affected, you know what works best for you. You can best describe your needs because you are on the ground working every day to improve the lives of the people, and all the challenges that you experience and the information that you presented here is first-hand information. And we really believe that through your lived experiences, you are able to also come up with solutions so that we are able to assist those that are in government in these departments to be able to resolve these problems together with us. So to our stakeholders, the committee will be receiving a presentation from the department on the migration of the ECDs to the Department of Education and its impact. And you've had the discussions and the presentations were dominated by this migration as well. And I think as the committee, we also have an interest to know what is going to happen, how is it going to affect the department. And I think briefly they have touched on it to say that the staff, everything, the budget is going to migrate to the Department of Education. But like I'm saying, we have requested the department to give us an update onto the migration, how it's going to take place, how it's going to unfold, at what stage it is, and so on and so forth. So for those of you who would be interested in attending our meeting, when we will be receiving that presentation, I would please urge you to register that interest with SIPONE so that we can extend the invitation to yourselves. You can be part of that meeting when we we receive that presentation, and you will be able to ask relevant questions based on the progress made on this migration. So please share your interest with SIPO. I'm not sure when that meeting is going to take place exactly in terms of the date, but SIPO knows he's working behind the scenes in terms of programming our meetings. So if you can communicate with him, he will be able to indicate when our meeting is going to sit. And as a way forward, just to announce to you that the committee will meet on Wednesday, the 15th of September. That is next week, Wednesday. where we will adopt the report for this webinar. And then on the 21st of September 2021, this report will be tabled in the House sitting. And after that, the committee resolutions, which will now become the resolution of the House, will be sent to the Department of Social Development for implementation. The department will then be given time frame to respond to the resolutions, and it is expected that the department will engage with other role players who will be cited in the report. After the department has responded to the resolutions, as a committee, we are going to call a feedback session whereby the department and other role players will report to you. Other role players, I'm referring to the municipalities, of course, will report to you on the work done in implementing those House resolutions. And we are hoping that this feedback session will be held physically. But as you know, we are now restricted by COVID-19. But by that time, I'm sure we will be guided by the rate of infections and the rate of the vaccination drive that would have taken place. I'm sure we will be guided appropriately there in terms of us having a physical meeting, but we would prefer to have a physical meeting for a feedback session. And I know that there are so many gogos who did not manage to attend the webinar today because of the challenges of connectivity, and I think most of them would be hampered in using the system. But they are equally running very successful ECD centers, you know. For instance, Bomme like Umam Precious Nkosi in Randfontein. She couldn't join us, but we know that she's running a very successful center there in Randfontein. So we hope that whatever issues that you have managed to raise, you have raised these on behalf of those that could not be here today. And in your comprehensive inputs and recommendations and interventions, we hope that they would also be covered by your contributions. So on this note, I would really like to thank all of you for really participating in this webinar. It was very enriching and it assists a lot, especially for us committee members to be able to also intervene and become the intermediary between the communities and the departments, because most of the time it's a problem for you to directly access the department. So we are one vehicle that you can use to access the department. On that note, I would like to really appreciate your continued support to the committee and your cooperation. But before we close, I think Member Engelbrecht, who is a member of the portfolio committee, will have the final say. She is tasked to deliver the vote of thanks to all of you. Honorable Engelbrecht, if you can come in and thank all the participants. Thank you.
Chairperson, thank you very much. I think this was a very, very important webinar, and the challenges are huge. And for the NPOs, really, this is a very important webinar that we need to have more often. Instead of having more academic discussions, I think, and I would like to suggest that we have more of these type of discussions with our stakeholders to find out what their problems on ground levels are, so that we can really get together with our municipalities and try and be the intermediaries to resolve these problems. So thank you very much for hosting this and for getting all our stakeholders together. I really believe that this is the start of a very fruitful relationships and discussions. And with that, I would like to really thank the MMCs for Health and Social Development from the cities of Johannesburg, Councillor Eunice Makina, and the MMC from the city of Tshwane, as well as the members of our committee, the officials from the Department of Social Development, Education, and from the Mfuleni municipality, Johannesburg, and the Tshwane municipality, as well as the representatives from the non-complying ECDs and the Operation Compassion, and representatives from the Greater Benoni Child Welfare, as well as from the Gauteng Social Welfare and Development Services, and from the Mfuleni Forum, as well as all the ECD practitioners that attended today. And then hopefully I haven't forgotten anybody, and if I have, I thank you very, very much for being part of this forum. And I really believe that we're going to have great things, do great things together, and really change what is happening on the ground and make it better for all our people, the people that are struggling and the NGOs, and really improve the circumstances on the ground. Ladies and gentlemen, I greet you all and have a wonderful weekend. Thank you very much, Jay.
Thank you. Thank you very much, Member Engelbrecht. I also want to thank you and also thank the support staff of the committee for doing hard work behind the scenes. Sipo, your hand is up.
Yes, Chair. If from even yourself, Chair, from our colleagues, someone can send my email address to the chat. It's not allowing me. It says I'm not a member of the chat because I'm of the chat group. I wanted to send my email address to the chat room. Otherwise, I can read it out loud. It's snqwala@gpl.gov.za. Thank you, Chair.
Also, a big thank you, Madam Chair, to you for the way that you have handled this meeting. We appreciate you and we support you. Thank you very much, and also to SIPA.
Thank you very much, everyone, for the fruitful meeting of today. Thank you so much.
Continue to take care of yourself. Thank you all so much. Have a wonderful day and have a great weekend. Yes.
Same as you.
Thank you, ma'am.
Okay. Thank you.
Bye.
Thank you. Bye.
Bye.
Thank you. Bye.
I know how to play with cards.
Bye.